Okay. Sarah, we're just about 5 minutes. Would you like me to open the broadcast?
Yes, please.
Okay, so at this point, I'm going to mute my mic, turn off my video, so you won't see me anymore. Obviously, I'm still here if anything needs to. Can't figure something out, I'll jump on.
How do I get in touch with you if I need to?
Did Krista share with you my phone number or anything? I can give it to you real quick.
I don't. Okay.
Yeah, no worries. It's
all right. Yeah.
610
610
462
462
5498.
5498. Got it. Yep. I'll send you a text if I need to.
Okay, sounds good.
Thank you.
All right, bye.
Hello? You hear me?
Good morning, everyone. Thanks for joining us. Welcome to Virtual Teal on the Hill. It's a little strange not seeing everyone today, and I'm certainly sad that we couldn't all be together, but glad that we came together virtually so that we can still continue to advocate on behalf of those people with Spina Bifida. As we are living in strange times these days, things like Virtual Teal on the Hill are very important to us and to our community. They help keep us connected to our cause and to what we're trying to do. And that's, pardon me, never more important than it is right at this point in time. I just wanted to start off by welcoming everyone today. Thanks for taking time out to join us and be a part of today and our training for tomorrow's activities. While we would love to be out tromping through the rain tomorrow here in DC on the Hill, we'd be going into empty offices at this point in time. So I guess we're going to do it the best way we know how, which is Plan B. And thank you for being part of that. Before we get started, I wanted to start by just giving you a little information. Just so you know, we had over 300 people register for today's webinar. They represent 43 different states and 5 different countries. So I'm so glad that so many people decided to join us, and currently we have about 130 people who have logged on, but we are recording this, and so everybody who signed up will be getting a link to this recording so that they can view it in their own time. And I'm sure we'll have people drop in and drop out throughout the entire day. So just to kind of give you a little bit of information about what's going on today, we've got a series of presentations set up. I'm sure everybody's taking a look at the agenda. But basically, we're trying to do about 30-minute presentations and leave about 15 minutes for Q&A afterwards. And how we'll do the Q&A is, if you look down on the bottom of your screen, next to the icon that says participants, there's a Q&A feature. Please put all your questions there. We have disabled the chat for this particular webinar today because, quite honestly, it's really hard to kind of go between the chat and the Q&A and get questions answered for people. And so if everybody can concentrate on the Q&A, the chat feature will only come to us, so you won't be chatting with one another. And that is really, if you're having a technical difficulty, you can use that if you'd like. But otherwise, please just concentrate on the Q&A session, Q&A icon, and use that for your questions for us. And I'll do my best to try to answer all of those questions, or to have our to get them to our presenters and have them answer those. But if we don't get to all of them, we'll be posting any pertinent questions on the website after this. Before we get started, I'd also like to thank our sponsors for today, Smith & Nephew. They came in as our blue sponsors. And for our silver sponsors, it's 180 Medical, Avion Pharmaceuticals, and Hollister. We couldn't put on this presentation without them. And so we really do appreciate that. And later today, or later this week, probably not today, tomorrow, or a couple of days later, the recording for this will be put up on our website, so that you, on the Teal on the Hill pages, so that way you can go back and refresh your memory if you'd like to. And we will be going through today during our agenda, we will be going over what our next steps are at the end of the presentations today. Before we get started, I thought I would just kind of briefly run over today's agenda for us. We're going to start, I'm going to give you a little bit of an update of what's going on at SBA these days. Then our friend Julie Himes, who works with us on all of our policy issues from Fagery, Drinker Biddle, and the District Policy Group, will be giving us a little update on the congressional scene and the appropriations process. That will be followed by a lunch break in which we'll have a presentation by Paul Seltman, the Senior Vice President of Public Policy and Government Affairs at Smith & Nephew. And we're also going to award our Tom Baroque Advocacy Award during our lunch break. 1 to 2 o'clock, Megan and Will, who are co-chairs of our advisory council, will be giving us a presentation on our advocacy priorities. And we have left plenty of time so that you guys can ask any questions that you'd like to during that, or we're hoping to get to as many of them as possible. And then at 2 o'clock, a couple of really special people, John Weiner and Robin Bowman, two physicians who are part of the National Spina Bifida Patient Registry Group, will be giving us an update on what's going on with the registry. We'll take a break after that, and then Nora will give us, will lead us on a session of finding your story, about telling your story when you're talking to people on the Hill. And then we will have a presentation from Nick Slope, who is our consultant at One Click Politics, who will talk about the software that we use and how we're going to use it for this. And then Sheila Roy, our Chief Operating Officer, will wrap things up and talk about what our next steps are. So that's how we have our day scheduled today. If all goes well, we'll get you finished before the 5 o'clock hour. And a lot of it will depend on how many questions we have and how complicated answers have to get. But hopefully we'll be able to do this in a meaningful way. Please feel free, if you need to get up and move around. You know, don't think that you have to sit in front of your screen this entire time. If you need to jump off and do something else, feel free to do that, but please come back to us so that we can kind of round out the day. Otherwise, we'll be talking with you throughout the day about a variety of issues, and if you have questions, please just feel free to ask in the Q&A feature. All right, with that, we'll get started with our Spina Bifida Association update. And if you'll wait just a couple of seconds while we get the presentation up, that'd be great. All right, here we go. So when we started down this road, it was a much different world than we're in these days. And COVID-19 has kind of taken over our life, and we realize that. But we are still focused on one thing and one thing only. And that is our mission. It's a new mission for us. We just crafted it at the end of last year. It was passed by the board of directors. It was based on a lot of feedback from a lot of different people. And we wanted to be simple, but powerful and also hopeful, and really speak to what we were trying to do as an organization. And what we're trying to do is very simple. We want to build a better and brighter future for all those impacted by spina bifida. What that means is a lot of different things to a lot of different people, and we're trying to do a lot of different kinds of activities to do that. But one of the things that we're very focused on, of course, is health of people with spina bifida. The reason we do that is no one else is focused on that, only SBA. The fact of the matter is that, you know, there are a lot of disability groups that focus on disability rights, and we want to be a part of those fights. We want to be a voice at that table, but nobody is the voice of people with spina bifida and their health except the Spina Bifida Association. We're it. We're the only ones that really are focused on that, and focused like a laser in a lot of ways. So, but we have to realize that COVID-19 has had an impact on that, right? I mean, we're not together today, unfortunately, except virtually. And that's the only way we can be because of it. But it hasn't changed our mission. We look at those efforts that we're now engaged in around COVID-19 as a part of building a better and brighter future for people with spina bifida and the people who care for them. Our staff is 100% virtual at this point in time. We have been for well over a month, for almost 6 weeks now. But we are 100% committed to the community and to keeping it connected during these times. You know, the fact of the matter is we've always had a pretty connected staff. We've always been working virtually in some way or another. So we were set for something like this to happen. We've been using Zoom for quite some time. We've been doing webinars. So those weren't new to us. So we've just had to learn to adapt a little bit, and we're not used to not seeing one another, but we see each other through Zoom, and that's helped a whole lot. So one of the few things that we did when we first started was we got something up on our website right away. There's a link to it on this slide. Please feel free to copy that down and use it. We change it periodically, and we date it every time we make an update to it, so you know it's when it was the most up to date. It houses a lot of different references and resources on a lot of different topics, so that you, if you're a specific topic you're interested in, you can navigate to that topic and find the resources right away. And we update and vet that information every time we get a good source of information on anything pertaining to this. We've also sent out updates to our database periodically, and we continue to do that as more information comes about or as we learn more things. We've also used social media a lot to try to widely broadcast those messages, because that's an important way to get the message out for people too. We've moved all of our events virtual at this point in time, like today's day. We're looking at education days, walk and rolls, happy hours, check-ins, and even chapter events through webinars and virtual events. I'm having some technical difficulties here, sorry. It's not advancing. All right, I'm sorry, we're having some trouble. I can't advance my slide. Hang on while we try to get this figured out. Okay, while we're doing that, I'll take a couple of these questions while we're trying to figure it out. One of the first questions from Danielle is, how will we get notifications on events that are being done virtually? Stay tuned to your inbox. If you have not signed up for the updates, go onto our website and do so. We will send out information through both Facebook and other social media, as well as through eBlast on things that are going virtually. Okay, I have found out what has happened. The person that we were working with for the AV has lost power in their neighborhood. He's trying to get things back up and running. So hold on, and we'll see if we can get this up here shortly. So anyway, the best way to get notifications on events that are being done virtually or any other way is by signing up for the update and staying tuned to social media. If you haven't become a follower for the Spina Bifida Association or for one of our chapters, please do so, because most times we will be putting it out through all different kinds of avenues on social media. Mark, thanks for the advice on this cursor, but that wasn't the problem. The problem was power. And so we're trying to, they're trying to get this figured out right now for us. So please hang on. If there are any other questions, please feel free to ask me those right now while we're trying to get this back up and running. All right, even without the presentation. I think what I'll do is go ahead and slog through this, and then we can send the presentation out to you, to everyone afterwards. So the other things that we've done, around COVID-19, we've held several webinars. The first one was Spina Bifida and COVID-19. That was on March 26th. And we had over 800 people who signed up for that, and over, I think over 200 people, almost 250 people actually were on the webinar. We answered a lot of questions. We had a ton of questions. We probably had about 90 questions, couldn't get to all of them. And so we have answered those, gotten those up on the website. The second one was, how is coronavirus affecting your mental health? That was on April 9th. We had over 100 people registered for that. And the last one was held earlier last week on the 22nd, is how can I help my child with Spina Bifida learn at home? That was held in conjunction with our Spina Bifida Association in Northeast New York chapter. And there were lots of people on that. Julie Yendra did it, and it was also broadcast on Facebook, although we were having some trouble streaming it for some reason. So we tried to figure out what the cause of that was, and we're trying to get that fixed. There's another one coming up on this Wednesday that's a part 2 on the learning, and then followed on Thursday by one on knowing your rights around COVID-19 and disability. So we hope that people will take advantage of those and sign up for those. The other one that we have identified of doing is how parents and caregivers can take care of themselves. That's one we're working on. We don't have a date for it yet, but we will shortly, and as soon as we do, we'll notify everyone of that. We have some additional plans too. One of the things we want to do is poll our social media followers to gain some insights into what emerging needs are and any additional topics for webinars are. We're also looking at how people like to get information. Are webinars the best way to do it, or should there be other ways to do so? So we're looking at written materials to put on our website, as well as additional webinars, short videos, all different kinds of ways that we can get information out, and trying to get mobilized to do that. We know video isn't always the best way for everyone to learn, so we're trying to think about alternate ways to get information out to people. So that's our COVID-19 response thus far. We continue to adapt as we learn more and try to get information out to everyone. But there is still other work going on, and work related to the Spina Bifida Association strategic plan, which has been up on our website for some time now, and I hope that folks have taken advantage and taken a look at it. But if you haven't, we're going to talk a little bit about that here. Before we get started, I wanted to talk a little bit about what we utilized as our guiding principles when developing our strategic plan, and they were pretty simple. We wanted to make sure that we were transparent, and we wanted to make sure that we used data to drive our direction, and we wanted the involvement of the Spina Bifida community in everything that we did. So those were the 3 things that we looked at, and where they all intersected right in the middle, that was our sweet spot, and that's what became our strategic plan. So the first element of our strategic plan revolves around research. And basically, the Spina Bifida Association, through the Collaborative Care Network, leads research to enhance the quality for the life of people living with Spina Bifida. Looks like we're back online here. So this is the first goal that we had. We lead research to enhance the quality of life for people living with Spina Bifida. How we do this is create a research agenda, support translational research, augment research and study requests, and conduct research and summarize research. So last year, you guys may
Can you do me a favor?
last year, you may remember that we had a survey that went out around research and things that I think it was phrased basically, what impacts your daily life the most? And there were a series of about 44 questions. They were based on topics that came out of the healthcare guidelines gaps that we had done. And we used the information out of that to kind of categorize and to try to determine what was the most important out of all of those 200, 300 questions that are left unanswered, so that we could try to narrow down on the things that really mattered to people within our community to create a research agenda. So from that, we actually created a research advisory council that's comprised of about 18 different people. Some of them are clinicians, some of them are parents, some of them are adults with spina bifida. It's just a multitude of a lot of different people who have some experience and interest in research that have come together and created working groups on the different topics that were identified out of that survey. Right now, we're in the process of developing questions that we'll bring back out to the community and get some input into. And from that, we will create a research agenda. That research agenda we will then disseminate widely, and we will try to find researchers who are interested in finding answers to those questions, because we feel like those are the questions that are most important to you, and because they're the most, and they also need to be answered because we don't know how to take care of people in those areas. And so that's how the research agenda plays into it, and that's what we're in the process of doing. When we talk about translational research, that's, all of the research that comes out, how does that really relate to the care of people with spina bifida and to improving their health? And any subject that matters or topic that even remotely comes into that, we will continue to support efforts around that by, clinical trials if need be, and finding people to be a part of them, or if it involves trying to develop studies of some sort and tests, then we'd like to be a part of that too. Any studies and research that are going on in the community, we try to augment. If it's good science and if it's answering questions that matter to our folks, then we definitely want to be at the table and help to make sure that you all are involved in those efforts. We do conduct our own research. Like I mentioned, that one survey that we did last year around our research topics, but we have others. There's one coming up here shortly that we hope to launch on catheters and insurance coverage. And what we want to do is take that information and summarize it, and then not only that, but also try to make sure that we are getting that message out to everybody within the community, so people are aware of what the most current research is. Clinical care is our next topic that we spend a lot of time on, and again, through the Collaborative Care Network, we improve clinical care for people living with spina bifida. We do that through our work with clinics and healthcare providers, again, translational research, outcomes work, transition support, adult care, and partnership. So we spend a lot of time trying to make sure that our clinicians are getting the most up-to-date information so that they can be in the know about anything that's coming up or has come up in the research that could actually change how they practice and take care of people. We've also spent a lot of time bringing clinicians together. You know that we did the clinical care meeting now, but the fact of the matter is we do a lot of other work that's not in a big meeting with smaller groups of clinicians. Translational research, a lot of that has to do with our guidelines and making sure that they're being understood and implemented in the way that they should be, and then changing those guidelines as need be. We're in the middle of right now starting to look at some of the guidelines that were done and do new lit searches to see how things might have changed, and they will be updated before long. Around outcomes, then that's our work with the National Spina Bifida Patient Registry. What we're trying to do right now is to determine the clinics that have outcomes at the top end of the spectrum and and those that are at the lower end of the spectrum, and try to figure out what the differences are to see if we can determine what it is that makes outcomes better in one clinic versus another, and how we can bring all the clinics up to that better standing, so that we're getting the best outcomes for the individuals in clinics as possible. We do a lot around transition support. We're working with AAP and CDC on a project around transition right now from pediatric clinical care to adult care. That's a big piece of what we're trying to do, and if we can answer that question, then a lot of kids today won't have the problems that a lot of our adults today have in finding someone who can care for them. And we haven't forgotten about the adults who are here. We continue to try to develop plans and partnerships that can help us to answer some questions about how our adults can get care. We're in the process right now of doing some work with the physiatry group to see if maybe we can get them interested in learning more about our adults with spina bifida and trying to make them perhaps a hub that adults can go to get care. And then we also make sure that we are staying connected to all those professional societies that are out there in the topical areas related to spina bifida, and to make sure that we're building on shared education and advocacy priorities that are out there that benefit both the physicians and the people that we serve. The next area of our strategic plan is education and support. We empower members of the spina bifida community with information and support to improve the quality of their life. And we do that through 3 resources that we have. Our information and support, most of you know Juanita Panliner. She is our National Resource Center manager, and she does a great job in terms of answering lots of questions that come her way. Some are easy, some are very difficult. But she's the voice on the other end of the phone that a lot of people turn to when they have questions and they need to get answers. And let me tell you, she's like a dog with a bone. She's going to make sure she gets the answers for people if there's one out there to be had. Through our education efforts, things like our education days, our webinars, our SBUs, all of those things, all the information that we put on our website, all of that falls into our education and information support categories. We spend a lot of time on those right now. We're starting to review all of our information sheets based on the guidelines, and trying to make sure that those are up to date. And so more and more of that will be changing over time. Network building is our next area. We serve as a hub to connect our chapters, clinics, and the broader community to improve the quality of life of people living with spina bifida. And we do that really through 2 simple means: our chapters and our communications. So we have some chapters that are doing some amazing things out there. And, you know, I mentioned earlier that we had the webinar on Wednesday in conjunction with the SBA of Northeast New York. And you know, it was really kind of comical how that happened, but it turned out to be a really good strategy. We reached out to Julie, and she said, "Oh, I'm already doing one, and it's for the Northeast New York chapter." And so we reached out to the chapter and said, "Well, we were thinking about doing one too, so why don't we try to just coordinate this?" And so we did, and it worked out really well, and we're glad to do that. But we're hoping that we can do more of that, because our chapters are really important to us, because they really help us to understand what's going on in the local level, because they are the people who are the closest to individuals with spina bifida and see more of them than we ever could. And so the fact of the matter is, without them, you know, there is a missing piece of the pie for us. And so we spend a lot of time working with our chapters, trying to make sure that we're communicating with them, they're communicating with us, and that we're also taking advantage of opportunities that come our way. We also spend a lot of time in our communications efforts. You know, when you look at the efforts that we put forth in the last few years, they've changed dramatically, and a lot of that is because we're trying to spend a lot more time telling everyone exactly what SBA is doing, because for a long time, we just kept doing and not talking about it, and people never knew exactly what was going on. And so our efforts have really been to use social media to broadcast what we're doing, but to also through written messages do that, video messages, all kinds of different ways. And so we're trying to make sure, recently we just updated our website, trying to make sure that our website, was giving the best information that we possibly could. It gets a lot of traction, a lot of people view it and go on it for a lot of different things, to including downloading all those information sheets that I was talking about earlier. But the reality is we can always improve those. And so if there are ways in which we can communicate that we're not, that would be helpful, please feel free to reach out and let Nora know, because we're always looking for ways that we might be able to improve, and we want to make sure that we are communicating with everyone as best we possibly can. Advocacy is probably my favorite thing. You guys know that. We advocate for positive change to the issues impacting the lives of people living with spina bifida. The fact of the matter is, if you don't speak up, you're not going to be heard and things won't change. And so we want to speak up, we want to be heard, and we want things to change. And we concentrate on a few things in order to try to advocate on behalf of people with spina bifida. Number one is appropriations. And we'll talk a lot about appropriations today, but let's just suffice it to say that without, no money, no mission. Well, that's true when it comes to research and everything else. If there's no money at the federal government, at CDC, the National Spina Bifida program goes away, and so does the registry. And there's been too much energy and effort put into that, too much good data in there, that we don't want to lose that momentum. And so appropriations is key to ensuring that we continue to keep that program alive and well. Teal on the Hill. While we'd rather be doing this in person today, the fact of the matter is, here we all are virtually. We can still have our voices be heard, and we're going to do that. But Teal on the Hill takes a little bit of our time to put together, to put all the meetings together, to do all the legwork to get ready for people to go in and meet with people, whether it be by phone call or in person. It takes a little bit. So we have a whole strategy around that. We also have a strategy around grassroots advocacy, and that's one click you guys will hear about later today, but we use a particular software that allows us to get the message out quickly and allows us to get into the congressional offices very quickly with a very succinct message, but one that is still heard and matters. And on all different kinds of topics, and something like that, we can get rolling pretty quickly and get a lot of people engaged. And we're always on the lookout for those kinds of activities. We do it also through advocacy coalitions. The fact of the matter is, I'm on so many different coalitions, and so are Sheila and other people on our staff, that it's been a significant portion of our time doing that. But we do that because we want to make sure that the voice at the table hears about spina bifida, is talking about spina bifida, so that you all aren't left out in any of those activities that go on. I'll give you a good, for instance, we're part of an organization called the ITEM Coalition. Now this coalition really started out around Medicare and Medicaid advocacy, but it's broadened to include more about medical devices, particularly around Medicare and Medicaid, but medical devices per se. And we used to just be a part of that coalition, and we'd sign on to letters every once in a while. But this year I was asked to be on the steering committee for that coalition. And in doing so, now that survey that I was talking about with catheters, it's not only going to be done in the spina bifida community, but it will be done in other organizations as well too, so that we can see how big of an issue this truly is. And then we can start to try to, as a group, come up with some strategies to address this. And last but not least is state advocacy. The fact of the matter is, a lot of work needs to be done at the state level. This is a new area for us. Will and Megan are working on some plans around this with the advocacy committee. And so we're hoping next year we might have an update to give you all to to kind of help you understand what our plans are in state advocacy. So that is yet to come, but it will be coming. We also look at physical health for the organization. We want to make sure that we raise money from diverse streams and we manage our financial resources very, very carefully. We do that through fiscal oversight in all of our development efforts. Things like walk and roll, our mid-year and end-of-the-year appeal, all of those things help us to make sure that we have enough money in the bank to pay the people so that we can do the work that's done. And then the last goal that we have is around people in operations. And it really talks about aligning all of our human, business, and operational resources to achieve our strategies. And we do this through 3 groups of people. The first is our staff, the second is our board, and the last but not least is our volunteers. And I'd just like to say that we have really put in place efforts to try to include more volunteers in everything that we do these days. We are, as I like to say, opening up the tent to everybody. We really want people involved in the things we do. By being a part of Teal on the Hill, you're volunteering. You're giving of your time and your energy and your effort, and that's important. Without volunteers, we could not exist. We depend on them for everything that we do, and we just couldn't do it without them. I'd like to thank, and I just wanted to put up there for everyone to see, this is our leadership team. Mike Hardy is our chair. Nicole is our immediate past chair. Maria is our chair-elect. Currently, we are in the process of looking for a treasurer. And then Marie Toming, who is the Field Relations Committee chair, is our executive committee member at large. Of course, my name, Sheila's, and Glenn Ray's. All of the 3 of us are up on our website. You can reach us at any point in time. And I'd like to thank the rest of our board members as well, too, because they give of their time. Our advisors, Tim Bry, we couldn't do half of what we do in the medical field without Tim. And then Stephanie, who is a legal counsel that advises us. But I'd really like to say thank you to each of you and to all of the volunteers. April is Volunteer Appreciation Month. And I think it's really important for folks to know that we do appreciate all of our volunteers. We couldn't do what we do without them. You help make things happen. So thank you very much. And with that, I will go to the Q&A and see if there's some questions that should be answered. We've got about 5 minutes, I believe, if I'm not mistaken. Kim has asked a question about our national convention. We are not planning on resuming the national convention. It was not feasible from a standpoint financially to continue that. We have put our efforts into Teal on the Hill. We hope that at some point in time, Teal on the Hill will have as many participants as the national conference did. We build enough time when we are face-to-face in Teal on the Hill for people to have some time to do networking and be a part of groups, but we are not planning on resuming the national convention. But please, if you're interested in something like that next year, do sign up for Teal on the Hill. Hopefully it will be in person next year. And it's a great time to come and connect with your community and your friends and do something really positive as well. Question on how do we sign up for the webinars? When you get a link, when you get an e-blast, there's typically a link that says sign up. You can also navigate to our website and check it out. It's usually on one of the pages, and you can usually find a link from there as well too. There's a question around COVID-19 that I will hang on to, and we will see if we can get you an answer, Cindy, later on around that. From Greg, there's a question, is there a blog or a chat room sponsored by SBA for those with Spina Bifida? There's not a chat room, there is a blog, and if you're interested in receiving that, talk to Nora Henley, nhenley@sbaa.org. She can tell you how to get signed up for that. How can I participate in research at my local chapter? First of all, research typically is not done at the local chapter. It's done at the national level. So I'm not really sure what you're asking, but if you're interested in signing up for research, then I would suggest that you sign up for our updates and stay tuned, because when we have any research available, we're a part of things, any research studies, then we'll be letting people know that way. And which universities, it's an interesting one, which universities and hospitals have a dedicated department for researching spina bifida? As far as I know, none of them have a dedicated department, but there are certain institutions, most of whom are involved in the National Spina Bifida Patient Registry, that spend a great deal of time doing research on spina bifida. They're a great place to start. But as to my knowledge, there's not any dedicated departments researching spina bifida. You will find it in various departments, because spina bifida doesn't have just a singular impact. It doesn't live in a singular place. We find that problem with the National Institutes of Health too, because trying to find out where to start on issues around neurogenic bowel has been really interesting. There's a lot of finger pointing that goes on. It's like everybody else is doing it, I'm not doing it, and nobody's doing it. So we're trying to get to the bottom of that. And then there's a question, is the Research Advisory Council something we can get involved in voluntarily, or is it an appointed team? No, that we put out a call and took applications. And so it was based on who applied, and based on what their interests were and what their experience was. And if it's something that you're interested in, you can certainly reach out to Judy Thibodeau, and she can put you on the list for the next time we're looking for candidates. Another question around DNA testing. Is there some correlation study or data being used to see if there's something in common with either the parents or those affected with spina bifida? There was a study going on. We have not had the results of it as of yet that I'm aware. That was actually looking, it was a saliva test if I'm not mistaken, and they were looking at trying to find some similarities to see if they could narrow it down to a gene or anything else. But to my knowledge, there's not anything else going on that we're aware of yet, but that does not mean that it would not be coming. And if so, when people reach out to us for studies like that, we typically, after they're vetted, then we will actually get that out through our update or an e-blast or on social media so that people can be aware of it. So we would always like to try to make sure that those kinds of things are getting out in the community so we can try to get those kinds of answers. All right, and with that, there's a question about SBA and Kaiser hospitals. I would suggest you reach out, Gregory, to Judy Thibodeau. She can talk with you a little bit about Kaiser and our relationship. And then there was a question from somebody who said that they had to drop off. Yes, if you do, you can come back on. If not, you will get a link to the full presentation later on, probably tomorrow. What groups are part of the advocacy coalition? So it depends on what advocacy coalition you're talking about. So some of the coalitions that we're on, I mentioned the item, we're also a part of NORD and several other rare condition organizations. We've been on the coalition of concern of citizens with disabilities. We're part of the National Health Council. There are a lot of different groups that we're a part of that we're doing advocacy with. So without some more information, it's really hard for me to answer that question beyond that. As far as starting grassroots organizations, if you're interested in something like that, I'd recommend that you first talk with Christy Wass, who is our Director of Chapters and Walks. She can probably talk with you a little bit about what our plans are around that. And there's a question about incidents of spina bifida versus other disabling birth defects. We are the most common permanently disabling birth defect that is compatible with life. So we're it in terms of the most complex. And I'm not sure the incidence in comparison to other groups, but you know, MS versus spina bifida is comparing apples to oranges, because there are a lot more people with MS than there are people with spina bifida. And it's not a birth defect where spina bifida is. So that's not a fair comparison. Plus, the way the organizations were started is totally different. It's just a total different ball of wax for us versus an organization that has a sudden onset of a condition later in life. It's just, you can't compare the two. I think the closest comparison would be Downs to us, perhaps, and even that's not a fair comparison. As far as the catheter survey and signing up for that, when we're ready to go live with that, then you will receive information about that through e-blast and social media. And no, there is not a list of neurosurgeons that don't run away from adults with spina bifida, unfortunately. We are working with the Hydrocephalus Association to try to get to the root bottom cause of why we can't get neurosurgeons to do that. I think we know the answer to it, but the fact of the matter is that neurosurgeons only want to see you when things are bad and not really any other time. I'm sorry, Robin, that I said that, but adult neurosurgeons, I should say. So anyway, the fact of the matter is that is an issue that we're aware of. We're trying to figure out some answers to that one. It's a tough nut to crack, but we continue to work with the Hydrocephalus Association to see if we can do that. All right, with that, it is now time for me to turn things over to Julie. Julie is going to be working with you all on the Congressional update and appropriations process, and she has been a great partner to SBA. We have been on the Hill with her for many years, and to be honest with you, I can't imagine doing this without her. So Julie, here's my handoff to you. Take it away, kid.
Thank you. Thank you, Sarah. It's great to be with all of you. As Sarah said, I'm sorry we're not here together. I'm sorry we're not walking the halls of Congress together, but I'm excited for the advocacy that's going to take place in the next couple of days. And do know that however your voice is communicated to the Hill, it will be a huge boost to our legislative effort. So thank you in advance. And I look forward to hearing about all the advocacy that you all do over the next few days. Hold on just a second. Okay. I'm going to just provide a brief congressional update. As we like to say, a picture is worth 1,000 words. Like the rest of the country, Congress too has been turned on its head. And as you all probably know, we love to talk in acronyms in DC. So we have new acronyms that we've introduced to our vocabulary. We have BC, before Corona, and we have AC, after Corona. So let's just talk a little bit about before Corona. The time period was January until early March. Seems like a lifetime ago. At that point, 2020 was seen as a time for limited legislative activity, with most energy focused on the election. And there was a limited agenda focused on appropriations, as well as drug pricing and surprise billing. Now we're into AC. That's after COVID-19. Mid-March onward, not surprisingly, the lawmakers are consumed by a COVID-19 response. The significant legislative activity has been oriented toward the pandemic response, particularly supporting healthcare providers and economic relief and stimulus. Not surprising, coronavirus and the response dominates all things Washington. There is some good news on the legislative front. Congress is set to return to Washington on May 4th, and the FY 2021 appropriations is happening. Much of Washington has been paused, but thankfully the spending bills, which is the appropriations, are continuing as they always do. I'm going to speak to you a little bit about the appropriations process now. What are appropriations? Appropriations are annual decisions made by Congress about how the federal government spends some of its money. In general, the appropriations process addresses the discretionary portion of the budget, military spending, research funding, health programs, but excludes the mandatory spending such as Medicare and Social Security, which is spent automatically according to formulas. How is the level of appropriations determined? Under current law, after the president submits his budget, which in a normal year, however normal Washington can be, would be early to mid-February. This year it was later, given everything else that's happening. After the president submits his budget, the House and Senate budget committees craft a budget resolution that allots a total amount of money for the Appropriations Committee. Once they receive these allocations, the House and Senate Appropriations Committees set allocations to divide total appropriations among the 12 subcommittees. What subcommittee is most relevant for Spina Bifida? The Subcommittee on Labor, Health and Human Services and Education, informally referred to as Labor H or Labor HHS, is the subcommittee of most interest to the Spina Bifida community. This subcommittee funds the Centers for Disease Control and Prevention, the CDC, and the National Institutes for Health, NIH. Specifically, this subcommittee allocates dollars to the National Center for Birth Defects and Developmental Disabilities, which houses the National Spina Bifida Program, the only federal program solely dedicated to spina bifida. Now I want to share a brief history of spina bifida and appropriations. As Sarah said, we have spent many years traipsing the halls of Congress, advocating for our appropriations agenda. And we are gaining traction year after year. And hopefully with your help this year, that traction will be even more formidable than it has been. The funding for the National Spina Bifida Program has remained level or the same for the last 6 years, about $6 million. And really, when the same dollar amount is provided for 6 straight years, the truth is that less money is given, as there is no accounting for inflation during the appropriations process. Yes, it's discouraging, but at least the Spina Bifida program has not experienced cuts as many programs have over the last few years. And last year, we really turned the corner in terms of the process. We made great strides, and we're hoping to build on that momentum this year with your help. Last year, fiscal year FY 2020, we always advocate for the year ahead. So this year's dollars that we're advocating for will be used in next year's budget. So appropriations for fiscal year FY 2020. For the first time ever, the US House of Representatives appropriated $8 million to the National Spina Bifida Program. The big bump was due in large part to the excellent advocacy of the spina bifida community. Sadly, the Senate appropriated only $6 million, and when the 2 subcommittees, House and Senate, conferenced, the number remained at that same level of $6 million. Don't despair. We're in the midst of FY 2021, and we've made great progress in our quest for additional funding for this year. As we did last year, we've requested $8 million, money that would be used for registry expansion, staffing, and allow for us to focus on issues like sudden death and sepsis death among our community. Together with Sarah and Sheila and Nora, we've met with staff from 25 House and Senate offices, all members of the Appropriation Committee. We've met with key committee staff, the majority and minority directors of the subcommittees who oversee the appropriations we're interested in. And we've met with other friends. We've met with the chairs of the Spina Bifida Caucus, and we've met with 2 members of Congress who have relatives with Spina Bifida. We've submitted our appropriations forms. This is standard operating procedure. We have to make an argument to every member of the House and Senate who we are interested in for increased dollars. And this week, we have the benefit of your help in the process. And truly, if this were happening in any normal year, the appropriations process would be pretty much put to bed. So I find a huge silver lining in the timing of this virtual Teal on the Hill, because your voice will make a critical difference in the amount of dollars that hopefully will come down the pike. Tomorrow, some of you will take part in phone meetings with Senate staff. We've targeted those senators on the Senate Labor, HHS, and Education Appropriations Subcommittee. Some of you will reach out to members of your member of Congress in the U.S. House of Representatives. And we will share details of how to get in touch with your member or whether or not you're participating in a phone call. And we have scripts for you and all of the contact information. And again, I'm happy to answer any and all questions related to the specifics of those meetings once this presentation is done. There are many challenges to advocating this year. I should add that there are always challenges to advocating this year. But given Corona, it makes advocating even more of a challenge. We have to recognize that engaging on topics outside of the coronavirus is going to be a challenge. Threading the needle between focusing on our important priorities while being mindful of the bigger picture. We have to make appropriate connections between Spina Bifida and the CDC and COVID-19 concerns. That should not be too challenging given the important profile CDC now has given COVID-19. It will be easier in certain senses to make our argument more cogent about the critical need for CDC funding. We also have to recognize the challenges members and staff are facing. They are working remotely. Some have gone back to live with their parents. They don't have the technology they would be privy to if they were on the Hill. Some of them are facing illnesses and other challenges. That said, we're excited about the response that the Senate staff had in our request for meetings. So we are basically batting 1,000 with one meeting happening in the next few weeks. The ask, the appropriations ask. As we said earlier, your voice, however it is communicated to the Hill, is such an important component to our ask. We're going to ask for you all to support an appropriation of $8 million to fund the National Spina Bifida Program at the CDC for FY 2021. And in communicating to your member of Congress, you can elaborate by saying that this money will go a long way toward expanding the National Spina Bifida Registry, securing much needed staff, and allowing for the resources necessary to investigate many issues of concern to our community, including the incidence of sudden death and sepsis death in our population. Looking ahead, well, hopefully this picture speaks 1,000 words as well, and hopefully sooner than later, we will see a country and a Congress turned right side up. We're hopeful that the appropriations bills will be voted on and that we will see an increase in funding. And we're hopeful that other key pieces of legislation germane to the Spina Bifida community will move toward passage. And with that, I am more than happy to answer any and all questions.
All right. So far, we have one question, Julie, and that is, will we be able to send emails if we aren't on a phone call? And the answer to that, if you don't mind, I'll answer that one if you don't mind.
Of course.
Is yes, you will be able to. In fact, make sure that you are on today's webinar and listen to the section around one-click, because there's a great way that you can get into one-click and do that. But you can, even if you're not on a scheduled phone call, we send out scripts to people who indicated that they'd like to make a phone call on their own. And so if that's something you're interested in, then you can talk with us after the webinar, send us an email either to me or to Sheila, and we can get that script to you so that you can make a phone call on your own and leave a message with one of the staffers on the Hill, or a few of the staffers on the Hill, actually. So yes, the answer is you can send an email and you can make a phone call on your own, even if you're not on one of the scheduled phone calls. When do we start our calls to our leaders? So Sheila, at the end of the day, is going to do a wrap-up that talks about the next steps. We are planning, if there are calls that are scheduled for groups, those are taking place tomorrow. People who are participating in those should have already received an email for those, as well as some information. So those are already set. As far as if you're calling a member of Congress's office on your own, not in a group, and are interested in that script, like I said, please contact me or Sheila and we'll get that to you so that you can have that information, do that on your own. And with the calls tomorrow, do we have specific time to call, or just any time? I received the email, but there was no time. Well, if you received an email and there was no time, then we missed something in the email, and I do apologize for that. So we will relook at those emails and make sure, because they are specific times, we do have a schedule. Julie, is there anything you want to say about that schedule tomorrow?
Well, I just want clarification. The scheduled calls for the Senate, or when we had suggested people call their member of the House?
From this question, I don't know the answer. So why don't you talk about both of those?
So my suggestion for those who are not taking part in the Senate calls and have been or will receive information about the member of Congress, the health legislative person, and all the contact information, generally the folks will be available between 9 and 5. That's not a guarantee that you will actually get a live person, but voicemail and their checking voicemail is done throughout the day. So my suggestion on that front is that you make the call sometime between 9 and 5. As far as the Senate meetings, as Sarah said, you should have received information about those calls that have been scheduled. There are 8 Senate meetings scheduled between 10 and 3. And like I said, and like Sarah said, if you did receive information that you were participating in a call with a staff person from a US Senator and there's no time on that, let us know and we will get back to you with the specific time.
Thanks, Julie. There's a question in here that I'll answer is there data on the increase in sudden death and sepsis death? The answer is no. Part of the reason we're asking for the increase is so that CDC has the funding in which to answer that question. We've asked them to look into it. They've been asked to by Congress, but without the funding to be able to do so, they can't. It means they have to pull somebody off of something else that they're doing in order to do that. And some of that may have had funding attached to it, so they really cannot do that. So that's the reason the funding request is imperative at this point in time. There's a question from someone who said, should I mention that I tested positive for COVID-19 and I fought it off? Would that hurt or help my argument? What are your thoughts on that, Julie?
I think depending on your level of comfort, it's just, it does illustrate that you have a health condition and that now you have another health condition. And if you're willing to talk about the complications involved in seeking care, or if you experienced any healthcare advice or had challenges because you had spina bifida, I think it makes your argument that the fractured medical system is alive and well even more obvious, and that the need to coalesce around a medical system that examines spina bifida in its entirety and is less fractured is critical. What do you think, Sarah?
I think that's probably wise. I think if it looks like it bolsters our argument, then I think it's a good use of time and effort. So I think it's probably worth doing.
And I certainly don't, I'm sorry, I certainly don't think you're going to be penalized for sharing that aspect of your story. I don't think you're going to, I don't think there's any stigma associated with having COVID-19. I think that if it added to your healthcare challenges and it compounded some of the difficulty in accessing care, then to Sarah's point, just further illustrates the need to revamp our medical system to care for adults with spina bifida.
Right. I have a question from someone who said, I had an email with my Congress member as well. It just said to call or email. How do I know if it's a group call? So I'm not quite sure what they're asking, but I'm going to take a stab at this. I think they're saying they got an email from us about a member meeting with a member of Congress. But I think a lot of it depends on the kind of email that you got. If there was a script attached, then that was if you signed up and said that you would like to call your member of Congress office. And that script is a suggested script to use when you call and either speak to someone or leave a message. If you are a part of a group that's meeting with the Senate, you would have received a much different email that would have given you call-in information. It would have given you who else. It would have told you, what member you were meeting with, at what time. It would have had much more distinct information in it. So if you got just an email that just has a script attached to it, that means we're suggesting that you call whenever you want to, between business operating hours at Capitol Hill, which is Julie said are 9 a.m. to 5 p.m. Eastern time. And you can do that whenever you want to on your own. If you're meeting with a member of the Senate staff, those are scheduled calls, and those calls would have received call-in information. So there would have been a conference call number and a dial-in and a ID number attached to it. So they're very distinct emails, and so it just depends on which one you received.
Sarah, let me just clarify, maybe this will help. There are 8 meetings, phone meetings scheduled with senators. They are, if you are from one of the following states and had volunteered that you wanted to participate in a meeting, then you should have received an email detailing that conference call. The states are Mississippi, Missouri, Illinois, Tennessee, Florida. I thought I was so confident telling you. Alabama, West Virginia. What state am I missing, Sarah? All right, well, I'll come back to that 8th state, but those are the states that are scheduled with staff from the senators from those states. So if you're from any of the other states not mentioned, then chances are you received an email with a general script for calling your member of Congress.
And those are scheduled tomorrow.
They're scheduled tomorrow
they
between 10 and 3. We have 8 meetings. Alabama just came through, so I'm not certain that that information about calling in has gone to the Alabama folks, but it will go sometime today.
it just went out.
Okay, so.
All right, so hopefully that answers the question in some way that makes sense to Hannah. Melissa Melissa asked if we received an email to make a call. Is it clear whether we are in a group or on our own? Again, I go back to if you received a call, if you received an email with call-in information, specific call-in information, a number and an ID, a meeting ID number, then you are in a call that is scheduled with a member of the Senate staff. If you received an email that just has a script on it, that is dependent upon you to decide when you want to make your phone call. You're not in a group. And what is one-click? Is it something I need to download or install? The answer is you don't have to. You just have to go in and create a username and password. That's all you have to do. And you'll get some information on that later in the presentations today on how all that works. Someone, Kara O'Neill, has said that she marked that she wanted to be a call but never got an email. So we'll look into that, Kara, and get back to you. Is Maine, Massachusetts participating? I'm not quite sure what you're asking, but you're more than welcome to call your members of Congress and leave messages. I don't think anyone from Massachusetts is on appropriations, so those were the meetings that we scheduled. So therefore, we're not doing group calls with Massachusetts representatives or senators, but you're more than welcome to do that individually. All right, with that, okay. Can we receive a general script email even if we don't sign up? Let me talk with Sheila and we will see what we can do about getting that out to all the participants in case they want to. And someone comes back and says, South Carolina, is that the 8th state?
Yes, thank you. Yes, Senator
Okay.
Lindsey Graham, thank you. You get the prize.
All right, so with that, there are several more questions, but unfortunately we have reached our time at this point in time. Like I said, we will see if we can get the scripts out to everybody so that they can see that. And for those of you who have calls with a Senate staff member, you should be receiving an email about direction on how those are going to go. So we'll get back to you guys in terms of what the specifics of each of those meetings will look like. So, all right. With that, we're going to take we're going to move right into we had really meant to go to lunch here, but unfortunately we had some bumps along the way getting started with part of our folks losing power during all of this. And so we got off to a little bit of a later start than we wanted to. So we're going to move directly right now to our presentation by Paul Seltman. I introduced him earlier today, who's with Smith & Nephew. And he's going to tell you a little bit about what's going on with Smith & Nephew and how it relates to Spina Bifida. So Paul, welcome aboard. And we're trying to get Paul up and running here, so hang on, everyone. All right, we're having a little technical difficulty. Paul's having some difficulty getting his microphone to work. So everybody take a few minutes, get something to drink, something to eat if you need to, and we'll be back as, well, actually now we're switching things around a little bit. We're going to see if we can get Dorothy up and running, have her start the presentation, and then move forward with Paul after that. So while they try to figure out what's going on with him. This is the fun thing about being part of virtual. You just never know what your day is going to be like. So I apologize for the technical issues that we've been having, but hang with us. We're trying to figure it all out. The fact of the matter is, before we get started, I do want to again say thank you to our sponsors, which include Smith & Nephew, 180 Medical, Avion Pharmaceuticals, and Hollister. Without their help, we couldn't do this. But I would like to introduce somebody who's really special to all of us at SBA. As you all know, last year we started the tradition of the Tom Baroque Award, Advocacy Award. It was named in honor of a gentleman who I had the privilege of getting to know and love. And he lost his fight with things related to spina bifida almost 2 years ago now. It's hard to believe. And he was a great force within our community. A lot of people loved and knew him well. And we all miss him. And we wanted basically to honor his memory in some way. And so we started this award. And today we are fortunate to have his mother here to make the presentation of this year's award recipients. And with that, I'd really like to introduce our good friend, Dorothy Baroque, and say hi to her. And I'll turn it over to you, Dorothy.
Thank you. Thank you, Sarah. And greetings from hot and sunny Las Vegas. I've admired many of you and the work you do for the spina bifida community by reading your posts on Facebook, by talking with you personally, and through the exchange of emails. To be with you in person would have been a pleasure, but having Virtual Teal on the Hill is the next best thing. Kudos to the staff and to the board of SBA for arranging the event. I'm honored to have been invited to present this award today and to participate with you as information about advocacy and spina bifida is offered. I first met Thomas Edmund Baroque in 1959 when I was a few months pregnant with him. Ed and I were asleep in our camp tent, nestled among the trees of an orchard in Central Oregon, when I felt, for the first time, movement in my womb. I woke Ed and told him the motion felt like the wings of a butterfly, gently letting me know our first child was growing and ready to be noticed. Tom's life continued to follow that same pattern, quietly and gently touching the lives of those around him. He faced life's challenges without complaint and with fortitude. His close friend from Guatemala, Helmut Leal, has this to say about Tom. Talking about Tom is talking about making the difference. Small, big, doesn't matter. Making the difference is action. Making the difference is example. Tom was action, and Tom was an example of how you can advocate for change and impact people's lives. He traveled the world and never said, I can't. Even in his worst days, he had a smile. Always in the painful days, he was helping others. His dream of coming back to Guatemala is gone, but the spirit he left in the streets of Antigua, Guatemala, where so many times he fell, got up, and kept walking, will survive forever. Tom's professional and volunteers careers encompass multiple aspects of the nonprofit world, where his advocacy skills helped others in need. Those skills were also used to teach us, his aging parents, how to weave our way through the medical quagmire that had been an integral part of his life. Tom left behind a legacy of kindness, following the example of St. Teresa of Calcutta, helping those often not recognized or acknowledged. He chose to learn from and to give to colleagues and friends he met through the Spina Bifida Association at the local, regional, national, and international levels. He valued the work done by SBA and would have enjoyed being here today to acknowledge all of you, but especially the people who have been chosen to receive the Thomas Barrock Advocacy Award. And so, it is with great pleasure that I present the award to two people who have worked tirelessly to advance advocacy for those with spina bifida: Megan Sorensen and Will Dickey. These two individuals embody what it means to be a volunteer. They're driven by passion, by creativity, and the will to get things done. No is not in their vocabulary. They were instrumental in developing the idea for Teal on the Hill, and they worked to bring it to life. Megan, as a former board chair, always said that when she finished her term, she really wanted to be deeply involved in SBA's advocacy work. And while on the board, she participated in national and state advocacy efforts. When Megan was chair of the Field Relations Committee, she worked to advance advocacy efforts at the state level. At the heart of her passion is her daughter, Carly, who serves as an inspiration for all she does. But Megan doesn't stop with Carly. If there's an issue that will enhance the lives of those with spina bifida, she works tirelessly. We learned early on that when Will sets his mind on something, there's no stopping him. He was the force behind starting the Carolinas chapter. From that experience, we knew he was a born advocate. Will keeps up on issues that relate to our community, and he engages his vast network to raise awareness and motivate others to take action. Will also has a secret weapon, his terrific sense of humor, which helps in bringing people together for a common cause, advocating for those with spina bifida. We know Will learned many of his advocacy skills from his dad, John, who showed his son the ropes through his actions as a tireless advocate for those with spina bifida. Megan and Will's spirit is infectious. They engage their families, their friends, and the spina bifida community to build a better and brighter future for all those impacted by spina bifida. Please join me in acknowledging and thanking Megan and Will.
Thank you, Mary.
Thank you. Thank you. Just to be mentioned in the same category as your son, it's not. Thank you.
He enjoyed you. You were good buddies.
Yeah, we were.
Thanks, Dorothy.
Yes.
We really appreciate you doing that.
Not sure of the
All
next
right.
step.
Well, the next step is I think we've got, I see some notes from the chat from the presenters, and I'm seeing a lot of virtual clapping is going on. Anyway, our next step is, first of all, to again congratulate Will and Megan, who really have been a force behind not only Teal on the Hill, but also our advocacy committee and getting that off the ground. And every year it's getting better. It's only 2 years old, so, you know, we've not had it very long, but the fact of the matter is they've got some big plans. I spent a day locked in a room with the two of them and Sheila, and literally locked in a room, working on plans for the upcoming years around advocacy. And they've got some really cool ideas that they're trying to make happen. And they've engaged a lot of really neat people to be on that committee. So I think we're in really good hands. And I think Tom would have been over the moon with it, because I know how much he loved advocacy.
Yes. Thank you.
All right,
Goodbye,
with that,
everybody.
we are going.
I'm going to leave the
Goodbye,
meeting.
Dorothy.
Bye-bye.
Thank you very much. And now I'd like to see if we can get Paul back up. So I think we're all set now. So with that, I'd like to introduce our good friend Paul Seltman from Smith & Nephew. Paul, welcome aboard. Thank you very much for doing this.
Thanks, Sarah. Can you hear me?
Yes, I can. You're good.
Excellent. And can you see me?
You bet.
Okay. Great. Well, thank you all. And we're really happy, on behalf of Smith & Nephew, we're really all happy to participate again this year in Teal on the Hill. And also, for many years, we've also been participating in the walk and roll in the DC area. Always happy to partner with you guys on a range of issues, and happy to be here. And today I'm here with my colleague, Rob Ganem. Rob is head of marketing for our wound care products. And I know that a lot of you are really interested in our wound care dressings in particular. But before we get to that, I just wanted to take the opportunity to provide an overview of Smith & Nephew for those of you who aren't familiar with us. The Smith & Nephew, we have a huge presence in the US, but we're actually a British company. And it's a 160-year-old company that started as a pharmacy. And the name Smith & Nephew sounds more like a law firm because it was started by a guy named TJ Smith. He opened a pharmacy with his nephew. And really, the company has never really changed that name, despite the fact that we've grown from a pharmacy into an initial wound care dressings manufacturer during World War I, which really launched us as a medical device company. And since then, we have grown into not just a wound care manufacturer, but also a manufacturer of a full range of orthopedic products as well. Today, Smith & Nephew looks a lot different than 160 years ago. We're a $5 billion company. We are publicly traded on the British and New York stock exchanges. We have over 17,000 employees across the globe. Now, more than a third of those employees are in the US. And I'm proud to say we do most of our manufacturing in the United States. Our biggest manufacturing site is Memphis, Tennessee, where we have around 2,700 employees manufacturing hip implants, knee implants, trauma products. And we also have a big presence in Massachusetts, as well as Texas, Oklahoma City. We also have a huge R&D facility in Pittsburgh, Pennsylvania for robotics-assisted orthopedic surgery. And we also have a major investment in North Carolina that's also another orthopedics business. This is just a snapshot of our products. We really are full-line orthopedics, except for spine. So we make hip implants, knee implants, trauma products like nails, plates, and screws. We also are in sports medicine. So if you tear a rotator cuff or you tear a knee ACL, we have the equipment to make those repairs. And then in wound care, we are full line wound care, from lotions to wound care dressings to advanced wound devices such as negative pressure wound therapy. And also we have a couple of key biologics products for wound care as well. And before I hand things over to Rob to talk specifically about wound care dressings, I just wanted to say a few words about the efforts that we're making around COVID-19, because we are a healthcare manufacturer, and we are trying to do our small part to deal with this very unfortunate situation and this crisis. So I think one of the things that we're really proud of is we've taken some of our idle capacity at our big manufacturing site in Memphis, Tennessee. And we have started, as of April 13th, we started making face shields there for healthcare providers. So face shields, unlike, say, a surgical mask, a face shield is a clear shield that protects the face of a healthcare provider, often during medical procedures, but also just in dealing with patients in the ER. We are now manufacturing more than 10,000 face shields a day at our Memphis facility. And previously, we had never manufactured these before. We had a small supplier and manufacturer we worked with in Alabama, and that supplier is now giving us additional supplies basically to add to what they were already doing. And we also may be doing some additional manufacturing outside the US as well, because obviously there's just unlimited global demand right now for personal protective equipment like face shields. We also have been donating to hospitals surplus surgical masks that we have that normally we use in surgeon training. And right now we're not really doing much in the way of surgeon training during the crisis. And so we're looking for hospitals that are in great need of these surgical masks, because everything really is in quite short supply right now. Another thing that we've been doing as a company is, because we are a healthcare company, we do actually have a lot of healthcare providers who are employees of Smith & Nephew. They may or may not practice medicine anymore, but they used to. And so we're actually allowing them to take 4 weeks of paid leave this year to go donate their time as a healthcare provider and to add additional capacity in our healthcare system. And normally, even in a normal year, all of our employees are allowed to get up to 1 full day off per year to do volunteer activities. So a lot of employees are taking advantage of that to donate that time toward the COVID crisis. And last but not least, of course, we also are making monetary donations to Red Cross and other international nonprofits to aid in the crisis. So that's just a quick overview of Smith & Nephew and what we're doing, but I do want to now hand things over to Rob Ganem. And as I mentioned, Rob is head of marketing for our wound care dressings, and he knows a ton about dressings. And really, Rob's here today just to not just tell you about our dressings, but really to tell you, help explain to you what to look for when you're looking at products to help prevent pressure injuries. So with that, I'll hand it over to Rob.
Unfortunately, we're having some technical difficulties. We can't hear Rob.
Oh, I'm sorry. Can you hear me now?
Yes.
Thank you. What I was saying is I want to echo Paul's comments about, being able to partner with you all. And in addition, we think about our patients and we think about the need for dressings. And one of the things we're most worried about is pressure, and the extent that pressure on any part of the body, but particularly bony prominences, what that can lead to, and it can lead to skin breakdown. And regardless of what type of patient you are, that's a problem for you. And we really set out quite a few years ago, back in kind of the mid 2000s, to create a product that would put patients and also healthcare professionals' needs top of mind, instead of just making a product that's square, which there's no problem with many of the dressings that are out there on the market. We just wanted to go to patients and healthcare professionals and say, what do they need to protect themselves the most and protect their patients the most? And a couple of the things that we found is that in general, dressings, patients in general have a hard time with them staying on for as long as they need them to. So they find that they're falling off, and there's a lot of wastage, a lot of cost that's happening that doesn't need to be there. The other thing that we found, if there is an open wound underneath the dressing, and in many cases, patients or family, it's rather unsightly. It's things that, they don't want to see that blood strike through the dressing. They want to feel that they have a certain level of dignity if they need to go out of the house and it is in an area or someplace where is going to be seen by others often, and that being incorporated was important to them. And then finally is that it's conformable and it's comfortable for them to wear for a long period of time. Not just at Smith & Nephew, but many other wound care manufacturers. We continue to produce technology that allows these products to stay on for longer and longer periods of time. But you want to make sure there's no skin reactions. You want to make sure that your skin is taken care of underneath that dressing if it's going to be on for an extended period of time. So we found that was very important as well. And so through that research, we came out with a leave-in life. That product looks like you see here on the right-hand side of the page. It looks like a flower. And then we also have versions that are specifically for the sacrum, as well as heels. Again, they're all built with these three main needs in mind that we found, both from patients and healthcare providers. Go to the next slide here. So, it's part of that was building a dressing, and there are many products on the market that are multiple layers. What we found is that looking for multiple layers as a patient is something that you should do. And the reason for that is the added protection, the added comfort, and in addition to that, the ability for it to stay on longer. All those things that we just talked about a few seconds ago. The key thing you should be looking for, if we started at the very bottom bullet on this page, is that it's a gentle adhesive. Something that's silicone adhesive is going to be much better on skin in general than something that's acrylic. I think we're all, familiar with, like what goes over your IV. That acrylic adhesive can be very tough on skin, and many bandages and dressings actually use that as their main adhesive. But if you look at most of our products, as well as some of the other major wound care manufacturers out there, you're looking at a silicone adhesive instead, which is very important. The other thing, if the wound is open, there's a layer in this dressing that's a hyperabsorbent layer. It is what actually allows this dressing to stay on longer if there's an opening and the wound is weeping fluid. Because instead of the fluid pooling and doing more damage to the skin, it actually gets trapped in this layer. And then most of that fluid is actually able to evaporate out of the top of this dressing. And then the other thing you'd want to look for is that the dressing can be completely sealed, because any open area, if it's open, or even if it's closed, if you have a ability for anything to get underneath there, then you have an issue of potentially bacterial or other antimicrobial concerns that are happening. So if being able to stay sealed, but it having that layer on top that can evaporate some of the moisture out is very important, so that it's breathable and again remains comfortable for a patient. Finally, I think you talk about pressure and why pressure is important. I think whatever product you're using, and you need to be aware that because pressure is a key concern, most companies have some data on how their dressings react if pressure is placed directly on them. This is a diagram representing what a bony prominence or point pressure would look like. And this is from some pressure mapping. But you obviously don't want to get into the oranges and reds on that right-hand bar. And when we built a leave-in life, when I talked about the research we did and the things that we found that patients and healthcare providers wanted, this was very important to us because redistributing or expanding out the footprint of that pressure is very important to us. And again, this is not something that we only do. It is important for you to keep this in mind when you're thinking about where am I placing that dressing, and if I'm trying to protect skin breakdown from occurring, that you know how that dressing is going to perform, because it's ultimately important for the patient's skin, and then other complications that are preventing other complications that could happen if that skin breaks down. So last slide for me. Again, we've talked a lot about resources and what Smith & Nephew does specifically for COVID. When it comes to wound care, we have two really nice places for patients or other people that are caring for patients to go to. On the left-hand side, that is our patient wound care website. There are resources above and beyond the leave-in there, so for other dressings and products that we have. And then on the right-hand side, this is a relatively newer resource that we have launched, but the number that you see down there on the bottom, it's called Smith & Nephew Responds. It is a 24/7 hotline for patients and healthcare professionals to call in, and they're going to be speaking to a nurse. They're not speaking to a sales rep. They're not speaking to someone who is trying to explain to them why they should buy a product. It is both for general questions as well as very specific questions on Smith & Nephew products. And when I say general, it doesn't have to be a Smith & Nephew product. It could be a general question about anything involving wound care. And those nurses are there 24/7 to take your call or anybody's call and provide support as needed. So thank you.
Thanks, Rob. Thanks, Paul. So we appreciate you all taking the time to do this for us and to share that information. And I know a lot of folks who will probably be very interested in that because wounds are a big issue within our community. So we are at 1:45. We will resume at 1 p.m. With our presentations. First up at 1 o'clock will be Megan and Will, our two recipients of the Tom Baroque Advocacy Award. We'll be talking a little bit about our advocacy priorities and taking questions. So please feel free to get up, stretch around, grab a bite to eat, do whatever you need to. And we'll see you back here at 1 p.m. on the nose, and we'll get started. Everybody have a good few minutes away. Enjoy your break.
Absolutely, period. I wouldn't want it any other way, period.
Okay, welcome back, everyone. Hope everybody had a nice little break. We're about ready to get started. We're going to kick this off with Megan and Will starting to talk about our advocacy priorities. It's great to see you guys. Congratulations on your award. Gotcha. And
yeah, no kidding.
We're even, Sarah. We're even. And to the entire staff, every time I've made you shed a tear, we're even. All of you.
All right, with that, I'm going to go away and let you guys get started. And when you all are finished with your presentation, then we'll open it back up for questions and answers, and I'll try to moderate those with you guys, okay?
Sounds great. All right, well, we will go ahead and get started. So again, I just want to make sure that I can, I'm just going to try. No. So this gets to the part you've heard about appropriations, and we've talked a little bit about what the process is and what our asks are, but now Will and I are going to dive deeper into what our asks are going to be. So whether you have a scheduled event with your representatives tomorrow, or you'll be reaching out to them via phone or email on your own time, what we really want to do right now is emphasize the things that we want to hit, our priorities, the things we want to ask for in the for this upcoming session. So what exactly are we asking for? Well, you heard about it earlier, but the most important thing we're going to ask for is funding for the National Spina Bifida program at the Centers for Disease and Control. And then second, and as you've heard, we've had to really change our legislative priorities in the wake of this new normal we're in, especially with COVID-19. So we had to do a little bit of a halt and a Control-Alt-Delete. So while this funding for the National Spina Bifida program is our top priority, we also want to include the disability community in COVID-19 relief bills. So we'll talk a little bit more about that coming up here. So let's talk about National Spina Bifida program funding. So we're asking for $8 million to fund the National Spina Bifida program. That program that you heard about earlier has been level funded at $6 million for the past 5 years. And with this increased funding, we'll be able to, that program will be able to fund research on sudden unexplained death in the spina bifida community, determine exactly the number of people living with spina bifida in the United States. Right now, we have the registries, but we know we're not capturing everyone. We know that our numbers are estimates and that we're not doing a good job of identifying every individual in the United States living with spina bifida. That money will also go towards increasing clinic participation in the National Spina Bifida Registry, which then feeds back into making sure that we have an awareness of how many people are living with spina bifida in the United States, and then also how they're being managed and how we can use the data on that management to really improve care for everyone. that money will also develop studies on social determinants of health within the spina bifida registry participants. So what that really does for us is talks about the things that impact health that aren't really around, tethered cord and hydrocephalus, but really around employment and housing and social interactions and those kinds of things. So those really important things that positively or negatively impact a person's health that aren't necessarily medically related. We want to wrap our brains around that and be able to positively impact that for the community. Those dollars will go towards creating a protocol aimed at improving the health of those with spina bifida and hydrocephalus. So expanding on what we've done with the guidelines and really going into protocols that approach spina bifida all the way around and address those things from a holistic standpoint. And then also fund some research on barriers to transition to adult care and analyze models for care delivery for adults with spina bifida. I'm preaching to the choir here when I say that is one of our biggest issues, is our ability to transition from pediatric to adult care, and then finding people who actually give delivery to adults in the models that we're used to as children. And they're not piecemealed together. I have a daughter who's gonna turn 18 in a week, or in just a few days actually. And what I'm finding is as we transition her to adult care, I'm having to individually find the specialists. And so those are things we really want to address. So Will, I've given the facts. So Will, why don't you jump in and talk a little bit about how these dollars and the work that the National Spina Bifida Program is doing will help the community directly.
All right. How it's going to help the community directly. Funding for Medicaid and grant programs, PPEs, personal protective gear, that's huge right now. That's face masks, latex gloves, things like that. Also paid leave for caregivers. And it also will help economic impact on payments for all people with disabilities, such as Social Security, disability, things like that.
Exactly. So I think the goal with this funding the National Spina Bifida Program is to really impact the quality of care for people with spina bifida. And then as Will was mentioning, we want to talk about the COVID-19 relief bills also. So this is an ask that's coming not just from the Spina Bifida Association, but also from the Disability Coalition. Lots of different organizations that support folks with disabilities are part of this ask, and it really is making sure that the disability community is considered when any COVID-19 relief bills are presented. So like, as Will mentioned, funding for that Medicaid grant program, as states run out of dollars and they haven't allocated appropriately, it's important that states have the Medicaid funding that they need to be able to support those folks who are getting their health care based on Medicaid. And then paid leave for caregivers, I think, is a really important thing to mention. As Will said, I took some notes on that because I think it's so important. So as people with disability lose their usual sources for care, and I'm sure there's some of you that have already been through this, that you haven't been able to see your physician, or you've had to see your physician virtually, and that there's been a loss of employment, or there's been a cutback in the people who support you, either through a home health care agency or those kinds of things. And so as that happens, or even being done with school, it makes a big difference when the schools aren't involved in that day-to-day activity for people. So it really leaves people with disabilities scrambling to find access to paid leave and 6 days to help their loved ones. So So for example, in our house, where we usually have that support through the school system, and what happens there now that we don't because schools aren't happening, then we need to be able to provide that care more for more hours a day than we're used to. So that and the downward impact of that is so important. So so anytime there's an emergency paid leave provision, all family members should be included. So paid leave for caregivers of folks with disabilities is a big ask in that COVID-19 relief. And then obviously that economic impact that Will mentioned, making sure that any, all dependent children's, everything, adults with disabilities, anybody who, even if you're claimed as a dependent, you should get your $500 economic credit. So making sure that folks with disabilities are involved in all those economic stimulus programs, regardless of how they're claimed on other people's taxes. Well, what else do you have to add to that?
I think that handles it. I think for the most part, that does handle it. Yeah, I think you're good. I can't think of anything offhand.
Those are the facts. So now let's just move in a little bit to how we do this ask. So normally, if you've been to Teal on the Hill before, Will and I do this great role play where we go in and we sit down on the stage and we interact with a former congressman who plays the role of himself, although I think he exaggerates a little bit. And so we were trying to think about how do we, you're going to be meeting with your folks differently. The ask, it's just different. So how do we communicate that approach moving forward? So, I know you're all thinking it, but if you have a scheduled call tomorrow, or you make a phone call, or you send an email, how do you ask for the things that we want to ask for? So I think we just have some tips for you, and feel free to ask any questions over chat, and we'll try, or over the Q&A, and we'll try to answer them as we go. But there were just a few tips that I think the two of us thought of that we wanted to get across. And the first is study a bit. So normally in this environment, we sit around a table, and at the end, we spend the last half of the day in the groups that we're gonna lobby with, and we go through all the information, right? We go through the infographics, which are accessible to you guys, so make sure, especially the infographic about the Spina Bifida program at the CDC, make sure you print that off. That's a great document to share, to study, really great information on there. So studying a little bit and knowing really what the ask is. No one expects you to memorize bill numbers or be so well versed that you could sit in on a session or something like that, but really understanding high level what the asks are and how they impact our community is worth it. Going in with that language that the information, but you can make it into your own language. I think it's important to know your representative, how they tend to vote, and then find some common ground with them. Well, maybe give an example, I guess. I'm thinking there are some representatives who vote really economic tendencies, right?
Yeah.
So,
and then there's, the ones that vote along the party lines. But the fact of the matter is, regardless of where you stand politically, if it's going to affect you, this is your time to speak and give them your personal story and how it personally impacts you. That's the best way I can tell you guys. We all are chomping at the bit to tell our stories. So just try to learn the basic asks. You don't have to be an expert. But what I'd love for y'all to do is, after you read it, try to intertwine it in your story. And this is the time, like I said, for you to do that. They want to hear from you. They may seem a little stone-faced because that's what they're paid to do. But I'm going to tell you, you can still get some emotion out of them, okay? And if you get that emotion just by a look, a glance, you've done your job. because you have to understand, in the disability world, we're a drop in the bucket. And they hear sob stories every single day. So the more you can work on your story and intertwine the issues and just really make it personal, the better off you'll be.
Exactly. And I think taking your story and like comparing it to what you can find out about your representative and then finding some common ground is really important. I think it's also important to know that they want to hear from you. They hear from lobbyists a lot, but they want to hear from their constituents. They tend to respond better to constituents, and it feels almost more, there's a little bit more humanity involved, I think, when they're responding to constituents. So, you know, regardless of how you, if you agree or disagree with how they vote or their political leanings, just making sure that you're a constituent of theirs and they want to hear from you. And so treat it that way for sure. And I think, like Will, you mentioned, finding their language is so important. So, you know, if you have someone who tends to vote economic priorities, right?
Yeah.
Then finding the way that, you know, making sure that people with spina bifida have access to appropriate care just makes them, it's better for the economy, for them to be productive, for them not to be, you know, to be able to be in their own homes, to be able to be part of the workforce. The investments that we make in knowing more about them and knowing more about what will support people with spina bifida has a positive economic impact in the long term. And so finding those kinds of connections are important. And then maybe your representative is someone who, you know, really is concerned about social issues and tends to be very aware of those things. And you know, I'm not going to lie, those are easier conversations to have. So finding that language, and then giving them stories, like Will said, if you tell them your story, oftentimes your story turns into stories that they repeat, you know, in
Absolutely.
convincing other people to vote, in their committee work, those kinds of things.
To put it in proper perspective, guys, especially to all my fellow constituents, as you all know, we are setting the foundation for future generations, okay? So our stories are naturally going to be unique. They're never going to hear stories like this because we're trailblazers. So keep that in mind, and most importantly, take advantage of it. Because like I said, they hear sob stories all day long. But if you can get just a little bit of emotion out of them, you've got them. And that's what you need to strive for.
The other thing is it's easy for us to assume that that they tend to know everything about everything, you know, when it comes to healthcare or finance or economy or ag or business or industry, whatever it is, because there's so much going on in DC, but they rely on people like us to give them the information they need to make decisions. So so as well versed as we are in the stories, in the topics, in the things that come very naturally to us, it's safe to assume they know nothing about it. And it could be even, you know, they could, it's not only could it be, it's highly likely they don't even know that there is a spina bifida program in the CDC. They probably have no idea how those dollars have been appropriated, or how it impacts those appropriation impact. And frankly, asking for $8 million, $2 million more a year for that program is nothing. It's decimal dust. I mean, you've seen the relief bills that have been passed. It's nothing at all. And so, but that's a good place to start, that what seems like a little bit of dollars will make such a huge impact on our community. And it's an investment in what we'll learn and what we'll know, and the ability for folks to lead productive lives. It really is an investment. So connecting them with that information is important. Just because they're elected does not mean that they know anything about the CDC or its programming. So important things to consider. And then, like Will said, just tell your story. It's a really good story, and that's the most important thing that you can do in those meetings is just tell them how it's impacted you. And you know, we definitely want you to hit our asks. We definitely, when you have those conversations, want to make sure that you mention the CDC funding and that you mention the COVID-19 relief. But there might be other things that you want to mention just in the telling of your story. One thing that's very important to us is the IDEA Act, and this administration has threatened IDEA. It's super important for even transitioning adults, you know, for kids, and that they have access to their needs in the public education arena. So that always comes up for me, just in the telling of my story. I always end up saying, please protect IDEA. Please don't let IDEA be dismantled, those kinds of things. So definitely, you know, in the telling of your story, you might end up with more in there than even are on our ask lists. Will, you have anything? And if not, we can go ahead and finish up, and we can go to, I can't see the Q&A.
No,
so.
You covered the numbers. Yeah, you covered the numbers and everything really well. I would just like to say a few things to kind of sum it all up and, you know, like I said, kind of rally the troops that are here. You know, this obviously is not ideal, but is the circumstance we're in. However, I'm a true believer that this could work, because anyone who has known me for more than 5 minutes knows that the reason I'm talking to you guys right now is because I started a chapter, and the main way I did it was I started a Facebook page. That's all I did, and I was persistent. So now is the time to really put all that to work and really show what we can do from our homes, because we live in a world now, as we've been proven, we can work from home and you can advocate from home. Most importantly, it doesn't stop here. It doesn't stop just after today or tomorrow. I need you guys to be diligent from here on out. Follow your representatives on Twitter, on social media. Regardless of whether you agree with them or not, you need to know what they're thinking, most importantly, where they stand on certain issues. Because as we're all learning, this whole country, various states are on various timetables. So with that being said, you really need to pay attention where your state, what is going on in your state right now, and most importantly, how it affects us. We can't know, unfortunately, everything in a state, but that's where you guys come to play. Let us know about all these issues, and most importantly, keep up on them. So like I said, follow your representatives on Twitter. Keep up with them. And, you know, unfortunately, this has affected all of us. I have been told that, unfortunately, we have lost some constituents due to this epidemic. So that's why it is also a crucial time, because the fears we have about healthcare and just our general well-being now are very real and very evident. So we need to really make sure we're staying diligent, and make sure we're all doing our part on a local and national level to keep things going, because that's where it starts, guys. It starts from the state government all the way up. This is not like business where things trickle down. It's the opposite. You work your way up. So we need you guys after tomorrow to stay diligent and keep us informed.
We're going to give you some really great tools to do that too. We're working on the grassroots advocacy stuff and the way to just easily make us aware through an electronic form of things happening at the state level that we can vet and give you language for. So over the next year, you'll see a lot more robust ability to at the state level. But in the meantime, we're always, both of us are here to help. If you see something that doesn't sound right, reach out to either of us. We will elevate it. We'll help you find the language, and we'll get you to the right people. Are there any questions in chat? I can't see it right now, so I don't know if Sarah, you can see it. You want to read them, or?
Sure, and there are several chats or several questions in the chat or the question and answer. The first one is, can you email the slides in the PDF format today to those who are advocating tomorrow? The fact of the matter is they're already on the Teal on the Hill website underneath the presentations button. They're already loaded, so we don't need to email them. You can go to the website, download them directly yourself. You can have them. All of the handouts are there in the handout section as well as there's a written document on our priorities. So all of that is available for you now. So you can simply go to the website, SBA's website, and go to Teal on the Hill and navigate within the pages for Teal on the Hill and get what you need. We've tried to be as proactive as we possibly can and put as much of that information up for you all. But the fact of the matter is, it's already there, so help yourself.
And this document, it's backwards, but it's my favorite. It's backwards on my, but it's the National Spina Bifida Program infographic is going to be super helpful for you. So make sure that you have that one and you print it out. Hang it on your bulletin board, your fridge, put it on your fridge.
The second question is, are those second set of items for COVID-19 bill or more general? So I think they were talking about the disability section of our priorities, Megan.
Yeah.
And I'll take a little stab at the first, and then if you can kind of jump in after that. Sure. So right now, Congress is not in session, and they just passed what's being referred to as 3.5. So they did something that just kind of modified the existing language that was already out there. That's all they could do, because until they come back in session, they can't do anything major. It's my understanding that the disability community has been feverishly advocating on behalf of the priorities that Megan mentioned. And so that is expected, if I'm not mistaken, to be addressed in 4.0, which will happen when Congress is back in session. Megan or Will, have you guys heard anything else? That's what I've heard.
That's exactly it. So on that COVID-19 relief bill, the disability in the COVID-19, it's the funding for the Medicaid grant program, the PPE, the paid leave for caregivers, and the economic impact payments for people with disabilities. Those are the four main things that the community is really hitting hard when it comes to COVID-19 relief bills. And if you want even more language around that, you can go to the Disability Advocacy Network. Their website is robust. They actually printed a statement on their stance on this that represents all of us in the disability. That the temporary relief, the disability community needs more in package 4, just as Sarah mentioned. And so that's available on the, it's the arc.org. And if you just THEARC, the arc.org. And if you go there and just look at COVID-19, you'll be able to see the details around that, the asks.
And one of our clinicians commented in the Q&A section and said, reminder that non-latex is really important in supplies. Yes. So when we're in advocating, you might remind people that people with spina bifida do have a severe latex allergy for the most part. And that
yes, that's a big deal. So that actually happened. I'm a nurse by trade, and I'm not a spina bifida expert, but do emergency and pre-hospital nursing. And in our quest to get more PPE to our frontline staff, we got shipped a bunch of latex containing products that had we not just read the box. So it's happening. So good catch, really important to mention.
Another question in regard to advocacy priorities and funding for Medicaid grant program. What exactly is that, and what would it encompass?
So Medicaid block. So Medicaid block grants have been part of our conversation for the for advocacy for 2020 anyway, prior to COVID-19. It's something states are given grants, and they're called block grants, and it's to fund their Medicaid programs. So if those block grants are smaller, or states decide to apply them differently, or even not apply for a block grant and privatize, or whatever they tend to do. If your block grant is smaller for Medicaid, it lowers the number of eligible folks, right? There's just less money. So then less folks are eligible to receive Medicaid benefits at the state level. And so making sure that those block grants are funded appropriately, that states have access to them, and that they're as expansive as is possible is important to us, because it will ensure that more folks have access to Medicaid, and then not only having access, but that the dollars are there to do things like support community-based services, in-home care, those kinds of things that a grant expansion would allow. So it's not just healthcare, but it's around community services. The goal is the more money, the less apt they are to institutionalize people with disabilities, and that's what we want to go for. Better access, more ability to stay home. Does that sum it up, do you think, Sarah?
That does. And I think there's something interesting, too, that I wanted to share with everyone. There have been weekly calls with the Senate Committee on Aging with organizations such as SBA and others that deal with people who are either aging or have disabilities. And they are really, really concerned about community-based care and home-based care, and what COVID-19 is doing to that population. And so there are a lot of efforts that are underway that hope to be addressed in 4.0 and future around those very topics. So beyond just Medicaid, they're looking at systematic things that could be helpful, that not only for COVID-19, but for the future for people with disabilities. So we have been participating in all of those calls, and we'll be working on, when that comes out, we'll probably be getting that word out through the Grassroots Network and try to get everyone engaged in that as well, too, because that's going to be a crucial piece of the pie as we move forward. So the next question is about SSI, and it's about recipients that are still dependents but over the age of 18. So while that $500 credit is available for those who are under the age of 18, it is not available currently for people who are above the age of 18 or above. So, and actually it's not for anybody who has a dependent that's 17 or older. It's just if you're under the age of 17, parents can claim them. But if you're in a situation where maybe you're still claiming an adult child on your income tax as a dependent, that you are not at this point in time eligible to receive that $500 stimulus payment, unfortunately. There's been a move afoot in the community to try to address that. I don't know how that is going to play out, to be quite honest with you. But we'll stay abreast of it and see if we can get to the answer. And of course, if it does become an actual movement, then we will be a part of that as well too, because that is important to people. But at this point in time, that's kind of stalled right now. And quite honestly, the whole stimulus package has been, shall we say, not smoothly implemented. And I think I'm being kind by putting it that way, but I'm trying to be very diplomatic here. Let's just say that a lot of people are still waiting to get their check, but then a lot of people are still waiting to get their income tax return too. So, things are just not going great right now with the IRS and the Department of Treasury. But anyway, beyond what you think about current politics or anything else, the fact of the matter is we will advocate on behalf of people with spina bifida and their needs, and this would fall within that category. We're trying to stay abreast of that and see where that lies, but right now I'm not sure where it's going to shake out in the long run, so we'll see. But we're going to see what we can do to be helpful on that. The next question, Will, if you could answer this one, how do we find out how your member of Congress has voted on issues that affect us?
That's a good question. Google. I don't know any specific sites, but I'm sure if you Google your congressman and various bills, you will be able to find out. I don't know of any specific sites. Do you, Sarah, by chance?
Well, you mentioned Twitter earlier. I mean, that's a great way to kind of follow what they're doing. I think if you go to their page on the Hill, then you can probably find out a lot about their stance on things. But Google is probably the best way to do it that I'm aware of.
And there's lots of different apps. GovTrack is one. It just ends up with they vote on thousands of things, so narrowing it down is hard. But GovTrack is a good one.
Okay. The next question is very similar, is how do you research the way your reps usually vote? We just talked about that. And how would you go about looking for common ground? That's a good question.
You want to take that one, Megan?
So what I do is look at their voting record, see if I can find something they have voted for that then, and even honest to God, even if you can't find anything, if you can usually find an economic impact, because oftentimes if people aren't voting for, programming or disability rights or something, there's usually in their mind, an economic reason for that. And so that's often what you can find. And then so I'm going to give you my go-to on this. My go-to is around healthcare reform and how important healthcare reform is to us. So, you forever have, everybody in the state of, it's a nightmare, right? In the repeal conversations. And what I say is healthcare reform is so important to us because of the pre-existing condition clause. And without it, Carly will not be employable because she'll need to remain under a certain income level to maintain health benefits. But because of the pre-existing condition clause, she can be employed, therefore insured, and therefore she can pay taxes. And that's if I can't find common ground, that's how I get to it in terms of tax revenue and people being contributors to society and those kinds of things. So there's a way to do it. It's not always easy. The other thing you can do is just look and see where they're from. So like physically where they live. And we have a big enough network that you can often find somebody connected to someone who would know someone who had spina bifida or is impacted negatively that they know by anything that's similar. So that's a good way to look too. And so if it feels really hard, again, that's Will and I are here. Like, say, this is my representative. This is what I want to say. The guy's a numbnuts. Help me. So, and we'll get on a call and see if we can't talk our way through a way to find.
And and I hate to speak in generalizations. I really do, but I'm gonna try to do it in a way it makes sense and where we can all relate. Me, as you all know, I live in the South. So it's very Republican, very conservative. So when I talk to my representatives, I usually talk about, the fact that a lot of young mothers, expectant mothers, get, the story or get recommendations that they abort the pregnancy. Why? because that's a hot button issue for conservative abortion. Okay, so go for it from there. Whereas when you're talking to a Democrat, as Megan mentioned, it's more about an economic impact, getting us employed, getting us to pay taxes, inclusion, you know, properly enforcing the ADA. So at the root of it, go to the theology of what party they're a part of. If you can't find any other common ground, that would be my suggestion.
So Will, I've had to kind of walk this line many times in offices. And you mentioned right to life and abortion, and that's a sticky wicket. But there is a way to introduce that is not, and it's pretty powerful, to be honest with you, because here's a little known fact that many of you all may not know is we get a lot of calls from expectant parents who want to talk with somebody who's walked in the shoes that they're considering walking in. And I will tell you that most of the times if we get those phone calls, those parents decide that they're going to keep their child. Probably I don't have statistics to back it up, but almost in every instance, if they make the call, they're really looking for a reason to keep a child. And so we always, through Juanita does her magic, works to find somebody to talk with them. We try to find somebody close to them if possible. If not, we'll find anybody that we can. And, you know, it makes a huge difference. And I've heard so many parents tell me this story. It's the same story of how they were told, and it always pretty much goes the same way. I'm sorry to tell you your child has spina bifida. When would you like to schedule the abortion? That's literally the way parents hear it. I'm not always sure that's the way it's delivered, but that's what they take away from it. And you know, that is whatever your stance and beliefs are around right to life and abortion. The fact of the matter is that's really awful for a parent to hear. It really is. And, you know, to be able to provide information that is factual and accurate and evidence-based is critical so that they can make the best decision that they can make for themselves. And that's what we try to do. And so when I'm on the Hill and this comes up, honestly, I say, you know, the fact of the matter is we get those phone calls all the time. And while we believe it's up to the parents to make that decision, we believe that they deserve the right information, which is fact-based and evidence-based. And that's what we attempt to give. But the other thing that we attempt to give is hope. And we provide that hope because we say that we're going to be here to support them and that Congress is going to be there to support them, because Congress over the past has, by providing funding for the National Spina Bifida program. So we're asking you not to break that promise to the expectant parent. And that's a very effective way to get to those ultra-conservatives that don't believe in spending, don't want to do that, but are really in that zone of, I really want to be supportive because of my religious beliefs, but my economic beliefs tell me not to. So and it works. I'll tell you, it works almost every single time, because when you say to them, you know, they're there because of hope and that they're part of that hope, then that really turns on the screws on them a lot. And I literally left, Will, you were talking one time about, you know, if you can get some emotion. I left somebody almost in tears after that. I know I got to that hardcore conservative because of that, because honestly, it poked the right button. And I was genuine in what I was saying. I believe that. I believe that we're here to offer that hope. I wasn't trying to use some tactic. It's a fact. But the fact of the matter is, it's using it to our advantage to help get the message across and to get them to listen to what we were saying. So I think you have to be very careful, but you have to think about your approach.
And to piggyback off what you said, to kind of put things in a nice little nutshell, you say providing hope. And that's what we're doing, guys. As I said earlier, we're trailblazers, okay? So ultimately, what we're doing now is setting a new foundation for future generations. I know a lot of you listening right now are very frustrated, as well you should be. But know that doing stuff like this can ultimately change the narrative. And that is powerful. And that is what we can do.
Great. The next question is about, do you think a story about an adult with spina bifida that worked his whole life working for the railroad climbing poles and is a mail carrier is effective?
I do.
Absolutely. No. Guys, any way you can tailor it to personalize it, get them to realize that their whole preconceived notion of our big bowl of awesome, that's it. That is it in a nutshell. So who wrote that? I applaud you, and you roll with it. That's the stuff we have got to do. Personalize it. Aim for the heartstrings, guys. This is your shot. I know y'all are chomping at the bit. Now's your time to do it.
Did you just say big bowl of awesome?
Yeah, I've always said that. It's my big bowl of awesome. Look, everybody with this has got like 3 to 4 different subconditions. So it's just a big bowl of awesome.
All right, and now a question from one of our clinicians. Any advice for clinicians who would like to advocate for SBA? Megan, would you like to take a shot at that one?
Sure. So I think that you can use the same personal stories. And through, so this is, I have to put myself in the shoes of like Carly's clinician. So you guys know how it goes. Over time, you become very close with these people, right? And they really are part of your family, for lack of a better term. And so I think that those personal stories and that the stories that you can tell as a clinician are just as good and effective, just in a different way than people with spina bifida or their families' stories are. So I think, telling about your work, telling about the work that you do to ensure access, especially when we're talking about CDC funding and transition and that kind of stuff. I think especially those folks who are struggling with transition to adult care, I think that is an important story to tell. And from a clinician's perspective, you can say how hard you have to work for many folks to try to get them transitioned appropriately and get them access to make them productive members of society. So I think it's the same story, right? I think you tell your story because it's your perspective, and you can pull on heartstrings just as much because you know personal stories for sure.
Yeah.
Is that
I think in general, talking about the impact that spina bifida has had on you personally as well too, from all the people that you've worked with, because I'm quite sure it has changed you. I know it's changed my perspective a lot since I took on this role. I mean, I had a very different view of the disabled world before I started here, and it's totally different now. And I have to tell you, a lot of it is just because of you guys have educated me. And I think that we as professionals, whether it be healthcare or nonprofits, whatever, have to speak up on, about what we learned out of all of this too, and the impact that it's had on us. But I think really the work that you do is critical in making sure you're part of that piece of it. We're all working on this together. The patient who's at the center of it, SBA, and you guys, we're all a part of it. We're all trying to make that. So the more that you're able to talk about your stories and the stories of the folks that you take care of, the more likely you are to make an impact.
I think the very first, was it the first Teal on the Hill 2 years ago? Carly and I had the pleasure of spending the day with Pat Firewalter. And she's a clinician, sits on the Professional Advisory Council and is brilliant. And so to be able to spend the day with her, meeting with her, obviously her representatives also, and hearing her stories, that's my best advice in that is tell your story just like we tell people with spina bifida to do, because it's just as good and just as impactful. Yeah, I mean, you don't get into without being, how you are. Just tell about it.
for the advanced technical savvy people in the room who are very familiar with Zoom and everything, get some pictures ready, get some slides ready. If you can get it to work, do it. Because a great example is a good friend of ours and in our one of the main people in our local chapter, Marie Delgado, last year. She came up to me after our spiel and she goes, Will, should I bring, Speedy D's baby pictures? And I'm like, absolutely, absolutely. Any prop, anything you could do to personalize it, do it. So take your time tonight. If you want to do a PowerPoint or something, get pictures lined up. That's the way to do it.
All right, so we'll move on to the next question, which it's a rather long question, so I'm going to try to condense it and get to the heart of what the question was. Basically, this individual's had an issue with their representative before. They want to call, but because of the representative, they're not quite sure if they should, and how to get to finding out what their representative is willing to do on behalf of people with disabilities.
That's hard. So you have to do it though, because the last thing you want is your representative to think that you had a negative interaction with them over some issue or something and you're backing down. That's not how this works. They need to hear you. They are your elected official and they need to hear you. So reach out for sure. Always, it's so important to be professional, right? To be respectful and kind and professional all the time in these conversations. That's the best of the best. We want our best foot forward. So I just recently had this experience over had nothing to do with spina bifida, another issue I'm kind of passionate about, that I was asked on behalf of the ACLU to meet with a representative who I not only campaigned heavily against, but a little smear, he did some stupid stuff and I was pretty vocal about it. And so then I call him up and I want to meet with him to talk about this issue. And I was just like you, I thought, oh my God, this is horrible. This guy's going to be like, screw you, lady. I want to meet with you. But he wasn't, because he also doesn't want, you saying, he wouldn't meet with me. That doesn't look good for them either. So we ended up having coffee and spending about 90 minutes together, finding common ground on an issue that our parties are on polar opposite sides of. And it went really well. And it actually gave me a newfound respect for him. Do I agree with his politics? Absolutely not. Do I think he's ridiculous? Most of the time. But I reached out to him, even though it made me nervous. I stuck to my ask. I didn't bring up anything else. And maintained the conversation was professional and respectful. And I heard him also, whether I agreed with him or not. And it was really effective. It will give you butterflies in your stomach. I'm not going to lie. It's nerve-wracking, right? But do it. Just do it.
Persistence.
I think the other thing too is, you can always address the elephant in the room. You can always say, we haven't always agreed on this, on issues, but I really do want to see if we can find that common ground. And that kind of lets them know that you're not on the warpath. You're not there to yell at them or whatever. And I think just being honest, and then, like you said, being professional and sticking to what you're talking about. Don't go off on a tangent. Don't get angry. You can't, that's not going to do you. And my mother always said, you catch more flies with honey than you do vinegar. And the fact of the matter is, if you can kind of keep it a little less confrontational, a little friendlier, collegial, you can usually get to the place that you need to get to, or to some version of it. But the important thing is to not give up and to not quit.
And don't don't be intimidated. If anything, they should be intimidated by you. They work for you.
Yeah.
Yes, exactly. That's the thing. They work for you. Persistence.
We've got about 5 more minutes. We've got about 5 more minutes, and we've got several more questions, so I want to try to speed through some of them. Question about how they can become a part of the committee, the advocacy committee.
Wow, great.
Oh,
That's
okay.
great. So we're going to be putting out a call for, we have so annually we'll turn over, depending on how it runs, the Federal Advocacy Committee, and shortly we'll be putting out the call for folks to serve at a state or regional level, and also on some subcommittees around certain topics: healthcare, education, employment, that kind of stuff. So just watch your email. If you're on the listserv, if you get emails from the association, you'll get notified about those, and how to submit your name for consideration for those groups. And there's always work to do. So if you want to get involved early and quick, just email or call one of us, and we'll
I'm not hard to find on social media. Yeah, give me a ring.
That's true. There's a question about the website. They've never used it before. How can they find information? If you're looking for Teal on the Hill information, if you just simply Google Teal on the Hill, it will come up to the pages, and there's a blue bar across the center of the page that has all the subpages. You can find the presentations, the handouts, all of that there. So I think that's what you were asking. I'm not quite sure. Comment about PPE, that most of it is going to hospitals and that there's little being done for home health arena, and you are absolutely correct. That's the reason the Senate on Aging is looking into that, and we'll be addressing that as soon as Congress is back in session. Question about spina bifida and susceptibility for COVID. The answer is, if you have any of the underlying conditions that have been outlined by CDC, then you are at greater risk. If not, you probably are at no more risk than anyone else. But just know that if you've had any kind of breathing problems in the past, depending on where your lesion occurs on your spine, that can have a huge impact on your ability to recover from something like this. But in general, probably not, unless you have an underlying condition. From Monica, who's on our advocacy committee, about finding votes, there's a website. It's www.govtrack.us/Congress/votes. So we'll see if we can get that. We'll see if we can get that up and on the website so people can find that. Okay, this is an interesting one. Our daughter is 21. She has sacral genesis, neurogenic bowel, and bladder. Still, they consider her spina bifida. Are you allowed to be in any part of the military? Where do we get help with employment? So, Will, you're an employment guy.
Yeah, I'm actually a job coach or an employment specialist. The best advice I could tell you is look up your local vocational rehab office. Go get hooked up with them. Go apply. Once you apply, they would be able to assist you with seeking employment. You can even take various aptitude tests to kind of get an idea what your interests are and what you may be interested in. Most importantly, they would be able to help suggest various vendors, like the one I work for, which is specific companies that help people get jobs. So look up your local vocational rehabilitation office. Great.
Thank you. And as far as the military, chances are probably not, is my understanding. But you know, you can get dismissed for bone spurs. So, you know, they're looking for all folks who don't have health issues for the most part, because you know they need to be able to rock and roll as military members. Last question has to do with photos. Someone who went last year said that they had photos on their phone. It moved the staff to tears, helped them to be receptive to listening. If it's a phone call, will we have photos, have opportunities on the phone call? No, unfortunately you won't, because it is just a phone call. Many of those folks are not set up so that they can do a webinar. And so as a result, we're not able to do that. However, you did get an email address, and that email address, you can attach a photo and send it to them. along with your thank you.
Do it.
So while you may not be able to do it in the meeting, you can do it afterwards for sure. All right. So I think
Remind them that photo. It'll be like, oh
Yeah.
yeah, I want to talk to them. Oh yeah. So
Yeah,
that's even more.
exactly. And you can also attach, the information that you can download from the web as well too. So, all right. With that, we are at the 2 o'clock hour. We've sped through every question for the most part. There were a few that I will have to try to answer offline that didn't really relate to the presentation. And so Will and Megan, thank you very much for fielding this hour.
Thank you, guys.
We appreciate it. Hi, Carly.
Make us
It's good
proud.
seeing you.
Hi, Sarah.
All right. And now I have the pleasure of turning things over to Robin Bowman and to John Weiner, two of our clinicians who are a part of the National Spina Bifida Patient Registry. They work very closely with us. John actually is on our board of directors as well too. And so with that, I'm going to go away. Welcome, John. Welcome, Robin. We're glad to have you. Thank you so much for joining us.
Thanks for inviting us. Sorry we're not in Washington.
Yeah, me too. So glad you're here with us now.
Hello?
Yeah, you guys are good to go. You can start.
Oh, terrific. I will go ahead and get started. Thanks again, Sarah and everyone for inviting us. I just have to figure out how to advance the slides.
Robin, you should be able to click on the slide and then use your backwards and forwards arrow on your desktop.
Perfect. Okay, so John and I are going to, let me just minimize so I can see the slides. John and I were going to talk about the National Spina Bifida Patient Registry and the umpire today. Oops. Well, our only disclosure is that for both of us, John's at Duke and I'm at Lurie Children's in Chicago, is that for both of us, our centers participate in the National Spina Bifida Patient Registry and for the umpire studies and receive grants from the CDC for our participation. The National Spina Bifida Patient Registry originated when back in 2005, the SBA sent a survey around to all of us in the Spina Bifida centers throughout the US. And basically what that survey identified was that there was a variety of different treatments that were going on throughout the US, and that the care that you would get at one clinic may not be the same care that you would get at a different clinic. And so it was at that time that the SBA, in conjunction with the CDC, recommended that there be a registry that was started in order to document the care, and so that we could look at what was going on and try to improve the outcomes. And so it was at that time that Congress authorized the creation of the patient registry. Currently, the registry has a little over 10,000 participants. Again, the registry started in 2008, and at that time there were 9 centers that received funding. 11 years later, we have 14 centers that are participating and that are funded, and we have 8 centers that are participating and are not funded. And we're currently on a 5-year funding cycle. The participation of any patient with spina bifida is voluntary, and the data that we gather is obtained on a yearly, annual basis when they return for their clinic visits. So what's the purpose of the registry? Is to identify the healthcare and the clinic practices that are associated with the best outcomes for the kids, the patients, the young adults that are living with spina bifida. How do we collect it? is that it's a questionnaire. When the registry started in 2011, there were 20 questions. Currently, there are 43 questions with 3 supplemental for skin breakdown. So it has expanded significantly since it was originally started in 2011. And then in 2014, we added the umpire, which is a prospective management from a urologic perspective for the newborns and infants in order to preserve renal function long term. And if you look at this map of the US, you can see the variety of centers that are participating. The blue means they're participating in both the registry and the urologic protocol. The red means they're participating in the registry only. The green means they're going on their own, that they're unfunded. And the purple means that they're participating in the umpire. And so you can see it's spread throughout the US. So why do we collect it, and what are we collecting? We're collecting the patient with spina bifida, their characteristics, the interventions they've had, the diagnostic studies they've had, and we're looking at the outcomes, and we're wanting to use this data in order to compare the outcomes through different clinics to see where areas where things are going well and where areas where things are not going as well as at other centers, so that we can standardize the care for all children and young adults with spina bifida to improve the care nationally. So in order to do so, we have to evaluate what we're doing. We have to evaluate our outcomes. And that means publishing what we have learned so far, so that we can share with everyone the knowledge that we've gained, that we can use it to improve our care for all with spina bifida, and that we can improve or increase our level of science behind our care, and that we can use that to go to Congress, to go to the federal government, to prove to them that this is a worthwhile investment, that indeed the outcome for those living with spina bifida can be standardized nationally, and we can elevate that care. So the first study that was published in 2013 was this one, and it basically showed that we can do it, that we can track our data, that we can have multiple centers involved, we can ask the questions, and we can overall, we can as a whole work together to document what's going on. So this study was just testing the feasibility. This was just showing that indeed, as a group, we can work together and get this job done. The next study published was a couple years later in 2015. It was published in the Journal of Pediatrics. Again, from the first 10 clinics. And it was on a little over 2,000 patients, and the average age was about 10. And it showed that those participating in the registry, about a majority of them were in the pediatric age range. So 85% of them were younger than 18 years of age, and that about 50% of them were ambulators. Or for those with open spina bifida, it was a little less than 50%. And it shows that bowel bladder impairment was a significant issue for those living with open spina bifida. The next paper, published a couple months later, was on the sociodemographic attributes, again published in Pediatrics by Michael Schechner. And what it demonstrated is that the older individuals were actually more likely to be continent, but to also have a higher incidence of pressure sores or ulcers, and as they aged were more likely not to be community ambulators. And interestingly, it showed a disparity that non-Hispanic Blacks were more likely to be incontinent or less continent. and that all of the outcomes, there were variation amongst the clinics except for community ambulation. A few months later, there was in the Physical Medicine and Rehab, there was a publication on pressure ulcers, which again was from all 19 clinics. It was for a little over 3,000 patients. And what surprisingly, it showed that at a yearly visit, about 20% of our patients reported some type of skin ulcer, which was very surprising to many of us. The risk factors associated with that was urinary incontinence, the lesion level, so that if you have a higher level or worse function and you relied more upon a wheelchair, that you are a higher chance of having a skin ulcer. The presence of a shunt, if you'd recently had surgery, which makes sense that you would be less ambulatory, and for those of the male gender. A subsequent paper in Physical Medicine and Rehab looked at factors associated with mobility. And this data was, again, from all 19 clinics and included about 2,600 patients. And it showed that community ambulation was associated with those that didn't have a shunt, those with lower level of lesion, and those that have not had no history of hip or knee contracture surgery. And you can see here that ambulation, as you'd expect, was higher or more prominent in those without open spina bifida. My last couple of papers that I want to review before turning it over to John to go over the bowel and bladder studies is a couple papers that were published recently in the Journal for Neurosurgery in the pediatrics section. The first was on Chiari decompressions. For both studies, there were about 4,500 participants. For the study reviewing the Chiari type 2, it showed that about 9% of our participants had undergone a decompression, and that the decompression or the risk for needing decompression was associated with higher lesion level, and that the younger children were more likely to also require a tracheostomy tube. When looking at the data, it also demonstrated that over the years, that since 2005, there's been kind of a shift away from Chiari decompressions. On the hydrocephalus front, again, it was the same number of participants, and it showed that about 80% of the patients with open spina bifida had a ventriculoperitoneal shunt, although there was a variation amongst centers with a range of anywhere from 72% to as high as 96%. And again, it was shown that the higher the lesion level, the higher the risk for needing a shunt. And when looking from the shunt, however, there was no change in treatment patterns before or after 2005. Okay, John, I'll turn it over to you.
Thanks, Robin. And actually, we go back. Let me see how. Sorry. So just looking at this study, there are over 4,000 participants. And before the Spina Bifida registry, you look at papers and there may be 200 or 300 patients in a paper. And just the experience at maybe Lurie Children's or at my hospital. And it's not very helpful to scientists when you're just looking at something at one hospital. There's no registry like this in the world, and it's really fantastic that we're getting information. It may not seem like we're moving the needle that far, but we really are because there's so many patients in the registry. I spent a lot of time worrying about bowel and bladder continence, and this is a paper that came out looking at bowel management in adults because there's just so little out there. I think the biggest paper was from Robbins Institution at Northwestern. It was 250 patients. And so here we have over 5,000 participants, 26% were adults. Again, the largest study was 225 adults. And you can see that bowel continence is improved as patients get older. They learn how to take care of things and learn how to work with their bodies. And so of adults, this is one of the more interesting things, and nobody's really reported large numbers of spina bifida patients' socioeconomic outcomes. So we found that in the registry of the adults, 14% were working full-time and 18% were working part-time. That together is about half the what you'd expect in able-bodied population, which is about 65%. 21% were students and about 28% were permanently disabled. Of those 25 and older, about 20% had a college degree. And again, that's about half of able-bodied. But a lot of people think that if you have a kid with spina bifida, that they're not going to become an adult. And here we have 20% have college degrees. And that 27% had gone to school after high school. Of those that were 25 and older, bowel continence was not associated with being male or female, whether you had private or public insurance, what type of spina bifida you had, or where your lesion was, or your educational attainment. The thing that was most statistically associated with bowel continence was employment. So again, this is really important information because we use this to talk to parents of 2-year-olds saying, we need to work on these bowels so your child will, get a job one day. We also, my partner, Jonathan Ruth, is very interested in disparities of care. What's the variation? We actually found that there is a big variation in surgery rates at different hospitals, and we need to find out why that is. A similar paper looking at bladder management in adults, again, about the same number of people, about 5,000. About 20% had undergone bladder reconstructive surgery, but you can see that rates vary from 12 to 38% among the 20+ clinics in the registry. Again, looking at variation in bowel surgery and combining that. I'm not going to go through the details of every study. This study in pediatrics, which is really one of the biggest journals in those of us who take care of children, these are really beautiful data, and this was working with our statisticians at CDC. This is how many people have stool continence by age and by diagnosis, and the red circles are open myelomeningocele, and the blue circles are the non-open types of spina bifida, and as expected, bowel continence is better if you have closed spina bifida, but you can see that it goes up with age, but really doesn't cross 50%. We need to do better. It is better in those with less severe forms of spina bifida, but we've got a lot of work to do here. Urine continence, pretty much the same thing, reaching about 50% for those with open spina bifida or myelomeningocele, and better for those without open spina bifida. Pressure sores. Robin talked about the paper, the first paper on that, and you can see here the red circles are, again, open myelomeningocele, and as patients get adult size, look at how common pressure sores are. That's something we all need to work on. If you have non-myelomeningocele or closed spina bifida, then you're less likely to have pressure sores. Ambulation. Green is community ambulator, and you can see as patients begin to get to be adult size, those that are community ambulators goes down, and those that are using wheelchair most of the time, in red here, go up. This was a paper that came out from headed by Kathy Smith, and just looking at differences in continence rates among individuals based on ethnicity, and they found that Hispanics were more likely to have bowel incontinence. It was pretty much even among all other ethnic groups in terms of bowel and bladder continence. And then this last study was, just came out in March of this year, where David Chu, who was one of my residents here at Duke and now works at Robbins Hospital, led this study. And we think that every patient should be getting an ultrasound every year to look at their kidneys and get blood work to make sure their kidneys are working well. And looking at the best centers, I mean, those that participate in the Spina Bifida Registry are some of the best spina bifida clinics in the world, and still only 62% are getting proper surveillance. Keep rolling it the wrong way. I'll talk a little bit about the UMPIRE protocol. UMPIRE stands for Urologic Management for Preservation of Renal Function. We really don't know the best way to manage the bladder at birth and how we continue that. And the CDC, through the hard work of Judy Thibodeau, who was at CDC and is now at SBA, really led us to begin this study at birth. And so in December 2019, this first paper came out, and currently we have 391 participants in the registry. The oldest are about to turn 5. We just got funded for another 5 years, so we'll carry this out to 10, and hopefully we'll keep getting funded to continue this to see how these people do into adulthood. Keep rolling the wrong way. I don't expect you to read this, but this is a very specific protocol of how we're going to manage the bladder of children born with open myelomeningocele. And we all agreed to it at these 9 centers. We're just now starting to get data. This was published about a year ago. And it turns out that most children with spina bifida are born with fairly normal urinary tracts. Only 4% had concerning findings on an ultrasound. 16% had reflux into their kidneys, but most of those were mild. And 8% had an abnormal renal scan. So basically, over 80%, close to 90%, are born with normal kidneys. And our job is to make sure those kidneys stay that way. So when you think about the UMPIRE protocol, it's trying to keep bladders and kidneys safe. I'll turn it over to Robin now.
Thank you. So this is what medical progress looks like. Currently, we have the largest database for spina bifida in the world, and the first prospective urologic protocol that, as John said, has run for 5 years and has just been funded to run for another 5. It's a lot of data. We're proud that we have more than 10,000 patients with spina bifida as participants, but obviously we need many more to include everyone living with this disease. What these scientific publications prove is that the registry and the protocol both work. They're teaching us new information, they're helping us standardize the care, and they are having an impact on the care that we're giving each and every day. But it's crucial that we continue this and that we continue to define what is associated with the best outcomes. Let's see if I can advance. John, are you able to advance?
No, I cannot.
Oh, there, it just advanced. Thank you. Oh, well, maybe not. Oops, now it advanced twice. Excuse me. There we go. What these publications prove is that the CDC, in conjunction with the SBA, we're making big differences with very small amount of federal support, and that the tax money really is making a difference for the care of those that are living with this very complex congenital anomaly, this complex disease, so that your tax money is encouraging more and more people to devote their lives to taking care of those living with spina bifida. And it's a hotter topic. It's bringing it to the forefront of everyone's mind. And there's more discussion occurring at scientific meetings, which is a good thing. Let's see if I can get it to advance. There we go. So how's the registry and umpire studies translating into making or improving the care for those living with spina bifida? As we just talked about, we're spending more time talking about education and employment. Our urodynamic studies have been modified to meet higher standards, and that we're standardizing the care across many centers for those infants born with spina bifida. And there's a lot more powerful data to share when we sit down to talk to expectant families or to parents of newborns and young children, that we can share with them that long-term, nearly 3/4 of patients are on catheterization, that unfortunately currently less than half of our patients are continent, and that about 1/4 of our adults have undergone bladder augmentation. But as John said, there's a disparity in that there's some centers that are doing more augmentations and other centers that are not. And we're still trying to figure out why there's a difference there. We also now ask about skin breakdown. As you saw several slides ago, that this is a significant issue. When 20% of our patients that are coming in annually are reporting skin breakdown, this is a big problem, because it's not just the skin breakdown, but skin breakdown leads to infection, which can then lead to the need for surgery or, God forbid, amputations. And so it's very important that we ask about it and that we have effective ways of treating it. That we are addressing bowel issues early and more thoroughly. And at least in John's clinic, they've been able to add some additional nurse practitioner to help support this. And that we're doing the same thing each and every visit, and trying to do the exact same thing and ask the same questions and inquire about the same health issues in every center that's involved in the registry, so that we can track all of these outcomes more closely. We're also now, as you saw, checking creatinine and monitoring the kidney function more closely. We've talked about how skin care is regularly addressed. We're trying to study the variations amongst clinics, and why at some patients at some clinics get some care where it's a different type of care at a different clinic. That needs to be standardized across all centers across the US. So currently our best estimate is there's 166,000 Americans living with spina bifida. That's twice as many than are living with sickle cell disease, and that's 4 times as many that are living with cystic fibrosis. So that's a huge number. We working together, as you saw the presentation, that fantastic presentation by Will and Megan, working together, we can make a difference. Again, when you're talking to your congressman, remind them this is the largest database in the world on those with open spina bifida, and it's the first prospective urologic protocol. That, interestingly, that we've been able to build up so that we have over 10,000 participants. We want many more participants. The difficult thing at our individual centers is that as we're adding patients and we're adding questions, so that the questionnaire, what we discuss, is more than double, the funding hasn't changed. So that even though we're taking care of many more patients, we're including many more in the registry, and we want to include even more, and we want to find out even more information, we're doing it with the same amount of money. And so we really need more funding. We need more funding in order to continue with the current sites, and we need to add other centers. Eventually, it would be great that no child, no adult with spina bifida were in the US and not part of the registry. And so this is what it looks like, is we need you to go to them and to ask for money, to seek money, to send it to the CDC so that we can put that money into the research and care needed for those living with this very complex congenital illness. And I want to thank you for listening to us. We are more than happy to take questions if there's time for that. Thanks, Sarah.
Sure. Thank you guys very much. I really appreciate that. We've got about 15 minutes. I'd like to start by asking a question. First of all, I've seen the slide before, and it is the best representation of what we try to do with Teal on the Hill that there is. So thank you guys very much for putting that up there. I was hoping it would show up. I just wanted to kind of ask a question in general that I think might help clarify things for people. You guys have been involved with the registry for quite some time, and you know, you have been in the room when there have been those long meetings discussing things. And I don't think people realize that no two hospitals, when we first started down this road, no two hospitals were really doing things the same way. And I'm not talking about just doing tests, but they weren't even doing tests the same way before we started down this road. So can you all talk just a little bit about some of the changes that you've seen in the practices of hospitals based on involvement in the registry?
Sure, I can pop in, and then I'm sure John has thoughts on this. Even just in, you know, the urologic protocol, even in our own center, prior to the umpire, it was very much dependent upon which urologist was helping us care for that child. There would be a bit of a variation in the testing obtained or the timing of the testing. And when you have that variation, even at a single center, let alone at multiple centers, it makes it hard to assess the outcome. And if you can't assess the outcome, you don't know what's working and what's not working. So you have to standardize the care in order to assess the care that's being given and the outcome, so that we can, you know, continue to do what's working and throw out what's not working.
Yeah, it's so much more complicated than you would think. I mean, I think people could understand why one neurosurgeon might choose to revise a shunt and another may not, that surgical decisions, but even simple things are so difficult. How do you define if somebody is continent or not? Who's asking that question? The patient may give a different answer to their doctor versus the research coordinator versus a nurse. So we're learning how to ask those questions better. And things like, you know, from a surgical standpoint, there are some patients that urine goes to a bag. That was kind of standard in the 1970s. We as surgeons think that's a failure. But for some patients, they may think it's better because they're not in diapers anymore. So it depends who you're asking the question to. So we're just learning how to ask questions better and do it the same way at every place. And I think we all start speaking the same language.
Thank you. I think that just kind of helps people understand. We talk a lot about things like outcomes and interventions and all of that, but at the heart of this, it's really trying to standardize what doctors do and when they do them, I guess, is one way, and how you ask the question even is important. And I think that's part of, go ahead.
Oh, well, people may think, well, why we already know what's the best operation? Well, we can't know what the best operation is. We can't agree on how you ask somebody if they're continent, or how do you ask somebody, you know, what their neurologic function is.
So there's a question that really doesn't relate to this, but they're asking about a clinic for adults in Western New York. My suggestion is that you contact the National Resource Center. They can help you with clinics. And there's another one about Midwestern states with no participation in the clinic. Do they have a spina bifida clinic that could potentially be added, or no spina bifida clinic at all? If no clinics at all, then how do researchers hope to try and gain data from those states? So there are a lot of clinics that are not in the registry. So just because they're not on the registry list does not mean there's not a clinic. I'd suggest you go to the website where we have a complete listing of clinics to look at your state and see what's available. But if there's information about your state and it's not being included in the registry, that's part of the reason we're asking for increased funding, because currently CDC does not have the staff to be able to even onboard clinics that are willing to pay their own personnel to be a part of this registry, because the registry has now gained enough influence and impact that there are institutions out there that are willing to be a part of it without federal funding. But we can't onboard them and we can't include them because there's literally not the bandwidth at CDC in order to process that, because that does take some of CDC's time. It's not just poof, you're on the registry. There's a lot of work that goes into that, and you have to be trained and you have to be onboarded and your information has to be vetted, and all of that has to still occur to make sure that we're getting the best quality information out of it. You can't do that without people. And right now, there aren't enough people at CDC working on the National Spina Bifida program. So therefore, that's the reason we're asking for more money. So that's a big part of it. What should I do? If I believe I was part of the registry until 2012 because I was at one of the children's hospitals in the blue categories, but once I aged out, I may not be part of it. You are absolutely correct. You probably aren't. And I know that this is something that CDC is grappling with. And again, it goes back to that funding issue. It's something that we've asked them to look into about what do we do with people who age out of the clinics, that follow-up. And if they're not going to a clinic that's in the registry as an adult clinic, then we lose that information. So it goes back to that age-old question, no money, no mission, no more money for CDC. This is something we can't do. So this is a good reason. This is a story that helps to say, hey, we need more funding for CDC for this.
And indirectly, Sarah, I think there are young trainees that Robin and I trained. One of them, for example, was a resident here in Durham and now is on faculty at Robin's Hospital, who he was going to go into adult urologic cancer research. And he got turned on by spina bifida research and saw what we're doing in the registry, and he decided to become a pediatric urologist, and now he's getting paid to do spina bifida research. And there's a real buzz among young urologists to do what we call transition care, to start taking care of the young adults as they age out of children's hospitals. So an indirect benefit of the registry is that it creates enthusiasm to take care of people with spina bifida as they age. And I think we're seeing a lot more young people who are interested in that. In the old days, there just weren't doctors interested in taking care of adults with spina bifida, or not many.
Here's another question. Are outcomes for individuals with spina bifida who do not have a spina bifida clinic in their area and are receiving healthcare services from general practitioners and specialists being tracked by the registry?
The registry is clinic-based, so it has to be a clinic to collect information. And it has to be a clinic that checks all the boxes. So the only information in the registry is from really top performing clinics, which is a problem. The question's a fantastic one and one we want to answer. We want to prove, we think that we're doing all this work that we have better outcomes. We don't know that for sure, but we're looking for ways to answer those questions.
If spina bifida is the #1 permanently disabling birth defect, what is the reason for the lack of medical resources for adults with spina bifida? Care and research seem to be primarily aimed towards pediatric and transitioning care. There seems to be very limited focus on adult concerns.
If you look back at old papers, only about 10% of children with spina bifida live to age 2. And this is true of a lot of birth defects, that in the 1950s, most people didn't survive to school age. And so for that reason, all the doctors taking care of these problems, like spina bifida or cystic fibrosis, were pediatricians or pediatric surgeons. So that there were no adult doctors that took care of these patients because there were so few adults with these problems. And so we've just been playing catch up. And I think the registry is helping us bring that to light, showing the problems and getting people involved.
I would say that this is not only the spina bifida community's concern, but most congenital conditions are in the same situation for that very reason, that medical care improved so greatly that life expectancy improved, but nobody thought about what was going to happen after the fact and how we were going to care for people. And I think we've got a long way to go in terms of educating the general medical community. The specialists that deal with spina bifida on the pediatric side get it. They've been involved knee deep in this for so long that they understand it, but their adult counterparts don't. And so we've got to become advocates. That's part of the reason that we spend so much time working in those medical societies, trying to find a foothold to build that communication so that we can start educating those specialists and even generalists. And we're trying to get to primary care physicians too. But the fact of the matter is that takes money and it takes time. And we're a small organization trying to do a lot of different things at this point in time, but that does not mean we're not trying. It's just not going to be an easy fix, because it's not just simply going out and getting a single doctor who's willing to treat someone, but you have to look at things like reimbursement costs and all kinds of complex issues, because we are not an easy fix by any means. Our issues take time, and they mean that doctors have to spend more time with our patients, and so they need to be reimbursed for that. And so it's not just a simple fix of finding somebody who says, yes, I'm willing to, but really we have to start looking at the underlying causes that might prohibit physicians from actually taking on that challenge too. And all of that takes a lot of time, energy, and money. Does not mean we're not going to get to it, but it just is going to have to, it's not going to be something that we can fix overnight by any means. And we have to do it in conjunction with other organizations, because it's not just our issue. It's an issue in general for people with conditions like the ones that we represent.
And Sarah, last year I had the great opportunity to go to Capitol Hill with some of the patients and families, that's where I met Will Dickey. And I think that we opened a lot of eyes that this isn't a children's problem. This is, we think there are more adults in America living with spina bifida than children. So I think this is a great opportunity when you're talking to people on Capitol Hill to make them realize that this is not a pediatric problem any longer.
Right. There are several other questions. We have just a few minutes, so I wanted to see if I can knock out some of these pretty quickly. A question about that their state doesn't have clinics. Is there a way that patients can participate even if their clinic does not? Unfortunately, at this point in time, there is not. It is clinic-based, as John said, although we are trying to look at other ways to get information out of people who are in areas that aren't covered by the registry at this point in time. But again, time and money plays into that. A question about is the registry raw data available to larger scientific communities to stimulate more research? Fact of the matter is you can partner with any one of those institutions that's in the registry and have access to the data, but your entryway is through one of the participating clinics, if I understand correctly. Is that correct, John and Robin?
Yes.
Yeah, the CDC,
Okay,
it's their data. We're collecting it for the CDC. But a great question, and if you've got a question, yeah, come to one of the centers and talk to us, and we can come up with an idea and pitch it to the CDC.
Yep. What is meant by urodynamic studies are now modified to meet higher standards? What's an example of the higher standards?
There's really not a lot known about the right way to do, or let me restate it. There's not a good agreement on the right way to do urodynamics on a newborn. In the Umpire study, we found that one place was filling the bladder 5 to 8 times faster than the rest of us. And so we're just trying to define the proper way to get the best information on conducting a urodynamic study. Again, just simple things like how fast do you pump fluid into the bladder? That's the easy part. The harder part is how to find agreement on those squiggly little curves. But we're making some progress on that. We're doing some stuff with machine learning.
I'm laughing because I sat in on some of those conversations, and boy, were they doozies. A question about addressing clinics that are recognized as clinic care partners but are not a part of the registry. That is correct. Clinics may also connect with SBA through the Clinic Care Partner Program. They agreed to meet 10 different standards that are listed on the website. And we're not really collecting data from them at this point, but the fact of the matter is they are looking at quality improvement projects and a few other things that relate similarly to the registry. And again, somebody's reminding us that they've grown up, that they're adults. And yes, we believe 65% of the people living with spina bifida are adults. And Mike, I will see if I can get this information to you about the infographics. It is up there. I'm not sure what the problem is, but we'll see if we can get that out to you. And are we coordinating data with groups like APD for HCBW? And I'm not quite sure exactly what they're asking. So I'll reach out to you about that. And if you don't go to a clinic but see a urologist at a clinic location, no, you're not included in the registry. If you have to be a participant in one of the clinics that's in the registry to be included in the registry. And I think that's the end of it. And we're only 2 minutes over our time, so that's pretty good. So John and Robin, thank you very much for joining us today. We appreciate it. Robin, it's great seeing you again. We didn't get to see you at the end of the clinical care meeting, but take care. Bye-bye.
Bye.
All right, and so now we are going to adjourn for a brief break. We'll be back at 3 o'clock on the hour. So everybody go grab something to drink, take a stretch, get up and walk around, and we'll see you back here at 3.
Okay, I literally just finished a 45-minute session.
right, welcome back everyone. We're at the 3 o'clock hour and we're ready to get started again. First up for our afternoon, the last part of this afternoon session will be Nora Henley, our Director of Marketing and Communications. And Nora's going to talk with us a little bit about how you find your story. So with that, Nora, I'll turn it over to you.
All right, thank you, Sarah. Hi, everyone. As Sarah said, I'm Nora Henley. I'm the Director of Marketing and Communications for the Spina Bifida Association, and it's my pleasure to work here and my pleasure to be here with you today. I do wish that we could all be on Capitol Hill together, but please know that your time spent with us today for Virtual Teal on the Hill is just as important and impactful. I'm really excited to talk to you about your story. I by no means feel I'm a storytelling expert, but I do know from experience that our community has some of the greatest people and stories out there. And it's my hope today that I can help you unfold your story to make a stronger impact in your advocacy work. We're gonna walk through why stories are important, ways to structure your story, and how it can make a difference in our asks. I know you've heard a lot about the CDC, the work the Spina Bifida Association has been doing, the work our amazing clinics have been doing, and that increase in funding. If you've caught yourself wondering a few times, like, how does this relate to me? How could my story support this? That's okay. I'm hopeful that you saw Will and Megan's presentations earlier. They did a really great job of walking through how our stories could fall into that, but just to bring it home, I'm gonna reiterate it one more time. The reality is, if you have spina bifida or someone you love has spina bifida, if you've had a surgery or multiple surgeries, if you're without a doctor or you have a team of doctors, if you've aged out of the clinic or you're concerned about your child or patient aging out of a clinic, that automatically makes you a really important piece of this work being done through the National Spina Bifida Program. The experiences that you've gone through because of spina bifida can shape the data that decides what we learn, what we know, and how we move forward. Today, your story is important because we cannot grow our work at that program without it. Because without your story and sharing what you've gone through, your legislators won't know just what that increase in funding can do. We know that it can change the future. We know that the future can be better and brighter. So I'll say it again for emphasis, you are a really incredible, important piece in all of this work, and we truly cannot do it without you. So with that being said, I'm gonna share a video message from my dear friend, Amanda. I had the privilege of being on Amanda's advocacy team for the 2018 Teal on the Hill event. She's just going to talk a little bit about her experience, the CDC ask, and then we'll circle back and I'll let you know what I learned about her.
Good morning. My name is Amanda Young and I'm coming to you from Columbus, Ohio. I'm going to keep this short and sweet because as a night shifter, I am actually headed off to bed so that I can go to work this evening. And that's part of my story, and that's what I wanted to share with you today. And why those asks, the funding for CDC research and investigation, and what those impacts have on my world directly. Because of that research, because of that funding, for the first time since I was in a pediatric clinic, I was actually able to put together a medical team that knows what neurogenic bladder is and how to treat it, that knows what a shunt malfunction looks like, and we can keep ahead of that so that I can work full-time, that I can enjoy the things that I do, like kayaking, jumping out of perfectly good airplanes, camping, meeting new people across the world and across the country. And begrudgingly, yes, paying taxes, because that means that I work, and that means that I'm healthy enough to do so, and I will never take that for granted. And I am excited to share that with the generations that come after me, whether it's families, whether it's young adults, whether it's adults, because when we all thrive, we make the lives of those that come behind us better. And we get to see them thriving and doing so much more than even we know about right now. And I'm so excited to be a part of that. I look forward to seeing you guys next year at Teal on the Hill, because I can tell you right now, there is nothing like sitting in front of the Capitol with justice over your shoulder, knowing that you have a seat at the table and knowing that you make a difference, and that those asks, even though they're tough, directly impact you and the people that will come behind you, and that is what kind of keeps me going. Have a great day. We'll see you soon. See you next year at Teal on the Hill in Washington. Bye.
Thanks for that, Amanda. As you can see, one thing I learned about her, and I'm sure you just did too, is her passion for shoes, which she decided to film in front of, which is one thing I love about her. In my time with her, I learned a lot about her, and we spent a full day together on the Hill, which apparently is a good time to learn a lot about the people in our community. Seeing how her story could support the importance of advocacy was a really incredibly and empowering thing to witness. On the Hill, she was always composed and ready for a fight. She was in a bright teal wheelchair, and she'd wheel it into a small Capitol Hill office, and without fail, jaws would drop when she would tell them, 1, that she's traveled all over the world, 2, she loves skydiving, 3, she has personally assembled a team of doctors that she has had to hunt down and coordinate the care between all of them herself, and 4, this is the hard one, she once had to take an emergency medical flight and was forced to pay every penny of that flight and the care after it out of pocket. I think every staffer we met with got a little bit of a shiver when they heard that. She walked them through who she was, what she's experienced, and that's all it took. It was powerful. They got to know her, and by the end of that meeting, she was someone they were connected to. Her experiences related to spina bifida or not paint a picture of who she is, and that picture is what sticks in the mind of the people who represent her. The next time they hear spina bifida, they'll think of Amanda, who she is, what she's done, what she's gone through. And with all of that, they'll remember that it's their job to represent her, to try to ensure that if they can help it, she doesn't have to face some of those tough and unfair parts of her life again. And hopefully, after you reach out to your members of Congress, you'll have the same relationship. They'll be thinking of you. So before we jump into structure, I just want to share some fascinating tips about storytelling. I think it's important because storytelling might not seem as important to you as I know it can be, but there's actually some real science behind its power too. Our brains process information in various ways and in various areas of the brain all the time. But when we see information in the form of spreadsheets or bullets or lists, only 2 parts of our brain are activated. When a story is absent, that's about all that lights up. It's really just processing the words. If you add a story, something that paints a picture and bubbles emotion, our brain is still processing words, but a variety of other brain regions light up as well. When we hear a story, events in the story can activate the same parts of the brain that would be activated if the events were happening in real life to you, right then and there. That's pretty cool. The point of all of this is to say that your story, which is personal to you, can easily become personal to the people who represent you. And that's why this time together and our teamwork and advocacy is such a big deal. We really are making a lot of friends on Capitol Hill. I love this photo that you're looking at on the screen. This is from our 2018 Teal on the Hill. Megan, who spoke earlier and spoke about her daughter, Carly, this is her daughter, Carly. Carly actually sat down in her representative's chair and kicked her feet up on the desk. And it was a really beautiful moment because I think it serves as a good reminder that the people that we're connecting to are also humans. They also have children, cousins, relatives, friends, and they're in that role for a reason. They want to represent you. So as I get into the 3 important things to help you share your story, I really want you to think about how you're planning on sharing your story this week. Since we can't meet in person, the ideal way would to be to send a video. We're all pretty digital now anyway. If you can't do it, that's all right. An email or a letter is also just fine. Maybe see if you can send some photos with your letter so they have a visual for who you are. If you have a call scheduled with a staffer in those meetings tomorrow, I suggest sending a photo beforehand. I think it will make a big difference for them to have those photos and maybe even your written story to reference as they're talking to you and getting to know you. If not, I still recommend sending photos. It can make a big difference for those strangers we're reaching out to and trying to make our friends. So let's dive in. Let's take a deeper look at the structure that might help you tell your story. These three components are research-proven aspects that make a story persuasive and powerful. The three components are transport, relatability, and empowerment. Transport is really what it sounds like. If we were telling storybooks or writing storybooks, it's probably something familiar from what your grade school days were like. I'd say that we should be writing about the world or place that we want to transport our readers to. That's what transport is all about. Even in an audiovisual form, taking your audience along with you, engaging them so that they are right there with you as you're unfolding your story for them, that's it. That's all it is. It can be challenging. There's no one way to make sure every story can transport our listener or reader. But the big thing to mastering transport is to follow the basic rules of a narrative. That is, the story can have a beginning, a middle, and an end. If you have these built into your story, there's a much better chance you'll be able to transport your listener or reader because there's a bit of a course for them to follow along. It's really up to you to decide where you start your story. We're all different. You could start it from a hospital room 20 years ago, maybe when you got your spina bifida diagnosis as a parent. You could start it from a child when you were first going to school for the first time, or you could start it from a month ago. That part's probably the most personal start, and that's really up to you. The really important factor in transporting is the middle, which is, I think, where the conflict lays, and it's one of my favorite parts. That might sound strange, but bear with me. If we don't have conflict, something that hasn't been hard, challenging, or is maybe the really important piece of transition in our life in some way, then in this situation, what are we asking our members of Congress to help us resolve? We're fighting for something. We're trying to get something across. So we kind of need that conflict to put that emphasis there. To try to explain this better, I'm going to tell you a story that's really stuck with me. For privacy reasons, I've changed the name of this individual and some key factors, but I think you'll get the point. Julie is a 52-year-old. She's an adult living with spina bifida, and she lives just outside of Madison, Wisconsin, the same city where she was born and raised. She has a really bright polka dot cane, and she looks just as Scandinavian as the Midwestern roots that she was born into. She has two beautiful teenage daughters who are spitting images of her. She teaches second grade at an elementary school that she's been at for 10 years, and her students love her. We also know that she hasn't slept more than 4 hours straight in over 2 years. Upon meeting Julia, it was really clear that she was experiencing more than just chronic pain. She started to have vision problems, headaches, and would often wake up feeling like she was choking or her jaw was locked. She began to sleep sitting up every night, hoping that it would alleviate the pain and, quite honestly, the fear. Outside of her primary care doctor, Julia hadn't seen a specialty doctor in over 7 years, not because she didn't want to, but because she was continually turned away. Julia is one of over 85,000 adults with spina bifida in the United States. We know that a significant portion of these folks, like Julia, have difficulty finding a healthcare provider to treat anything related to spina bifida. Physicians with the knowledge to not only treat, but consult adults living with spina bifida are hard to find and sometimes difficult to access. Because of what we know from the National Spina Bifida Program and the relationships with the clinics and physicians we've established, we were able to find a neurosurgeon to see Julia, and that doctor performed a common yet very vital surgery that she needed to live pain-free and to finally sleep normally again. I believe that Julia shouldn't have to wait in pain to be treated by an expert. Even with the information that we've gained from the program, it's not enough. You see, the neurosurgeon who operated on Julia, she was a pediatric neurosurgeon. Julia, a 52-year-old, shouldn't have to be tossed around until she could have a pediatric neurosurgeon agree to treat and operate on her. None of the adults in our community should. We need that increase in funding. We need it for the CDC because it can save lives. We need that funding so that adults with spina bifida aren't forced to go to the ER or feel that they need to turn over every rock to find one physician to see them and address a basic need. If Julia had been treated earlier, she might not have lost her job. She might have been able to go to more of her daughter's softball games, and she definitely would have gotten more sleep. We need the support of our legislators, and the CDC needs an increase in funding, or else we might have stories like Julia's with a lot harder of an ending. Sometimes, like Amanda said, these asks can be tough. They can be tough because of what we're addressing. It requires us to be a little vulnerable and a little bit emotional, but that's also why they're so important. Julia's story is hopefully a good example of how your story can be structured for our advocacy work. If I told it right, you were hopefully transported with me to meeting her. We learned a little bit about her, where she's from, what she does, who she is, and then we got brought into the middle where that conflict lay. And that conflict was a really important part of the story that transitioned us to the end, or in this case, the ask. Her conflict was that struggle she had with her pain, the uncertainty, and the troubles of finding a knowledgeable medical professional. Although her conflict did have a resolution, it's not the end of our story. It's our job to let people know that even if we have one win, that doesn't mean that the problem was answered. So much more needs to be done and can be done. And that's where our asks come in. That takes me to relatability. This is probably my favorite story component, and it's a big one. A good story may take us to a moment in time or a phase of your life, but it also needs to make us feel something. You might have felt something as I was sharing Julia's story. Why did you feel something? Could you relate to her? Did you empathize with her? If you did, that's good. If you want a story to stick, it needs to resonate emotionally with who you're telling it to. This can be done through relation or empathy. This requires us to be vulnerable and emotional. One of my favorite quotes goes as follows: "Facts and figures can change minds, but emotions and vulnerability can change actions." I think that's a good example of what we saw earlier in that photo with Carly in that representative. I think he could probably relate to her and Megan in that room a little bit. He probably got a kick out of seeing her in her desk because my guess is he has kids too. And hearing Megan and hearing Carly and the stuff that they've had to gone through, he probably hit a note with them. Another really important piece of all of this is, again, you. You are the first person you need to move in your story. The best way to know if your story has emotional resonance that makes it relatable or draws on empathy is if it makes you feel something. And that's where honesty comes in. You have to be honest. Rooting your message and honest emotional content will help you feel connected to what you're saying and also help your audience feel connected to you. And the last but not least is sympathy. Sympathy creates distance. It causes the person to feel pity and sorrow, and we want empathy. It's relatable, something that can make them happy with us, joyous with us, or sad with us in those times that we're also sad. It requires them to be your partner, and it leads them to take action from you. I love this, but a few great examples we had actually came from last year. These are great examples of relatability that are from the real meetings that we had. In one meeting, folks were meeting with a staffer, and the first question we always ask is, do you know anything about spina bifida? And that staffer had shared that he had just gotten a spina bifida occulta diagnosis. That was incredible. I mean, nobody expected that. Another meeting, we had a teacher who had previously had a class with 2 students who had spina bifida. She was so excited to meet our group. She was just charged, ready to talk, and ready to help. In another meeting, a staffer had shared that they had a goddaughter with spina bifida, and she was so excited and moved by our work, she wanted to come to Teal on the Hill in person this year. And a really big one was a representative who came out and shared something with our group that he had never shared with anybody before. He had had a baby sister who passed away just 2 months after birth. These were the first people he had told that to. It was an incredible moment of connection and relatability. When we're honest about who we are and what we've gone through, you never know who might step into your story with you. That takes me to the last component, which is empowerment. This is the part where your story comes together for the very reason we are here today. Empowerment is what inspires action after you've transported the reader. They'll have found a way to relate to you as you've unfolded your story in front of them. And now we're taking those 2 components and we're asking them to act on it. Why are you telling your story? If your audience was left with one message, what would it be? How has your story encouraged your legislators to want to support an increase in funding for the National Spina Bifida program? Like I said earlier, if you have spina bifida or someone you love has spina bifida or you have a patient with spina bifida, you're automatically a really important piece of the National Spina Bifida program. And so is your story. If you just ask yourself, what do you want to advocate for? What motivates you to seek change? Your story will unfold right in front of you. I would be willing to guarantee that when you share it and you've transported your legislators to your shoes and they've related to you and empathized with you, they're going to be ready to help. I'm going to end my time here today by sharing a video of someone who really made a wave on Capitol Hill last year with her story. You might have seen this video before, but even if you have, I really want you to listen to how she's sharing her story, how she structured it, and how it all plays into the asks. And then watch the final pieces and really look to see how the legislators she's talking to have responded. It's pretty incredible. This is Donna
Nora,
Jones. Yeah.
Nora, we're experiencing some technical difficulties. They're trying to get the presentation back up.
Okay. I can always share it from my screen if I need to. I'm sure I have the video up, but Donna Jones was an adult with spina bifida, and last year she testified before the House Subcommittee on Labor, Health, and Human Services. So I'll wait a minute and see if we can get the screen up, and if not, feel free to ask any questions if you have any questions.
If you can share your screen, why don't you go ahead?
I think I should be.
Yeah.
All right. Sorry, everybody. As we're all learning, the virtual world sometimes takes some getting used to. 1 second. Make sure I have the right one. Okay. All right. This video is really important, so I have to show it. Okay, I hope this works.
Thank you, Donna, and we'll recognize you for 5 minutes.
Can you hear the audio, Sarah?
Good afternoon, distinguished committee members.
Yes.
Thank you for the opportunity to provide you with testimony of my experience of what it's like to live as an adult with spina bifida. My name is Donna Jones.
Thank you, Donna, and we'll recognize
to
you
represent with honor the Spina Bifida Association. We are requesting $8 million for the National Spina Bifida program housed at the National Center on Birth Defects and Disabilities at the Centers for Disease Control and Prevention. As a former Capitol Hill staffer, I understand just how important these committee meetings are. When I was born on the island of Guam in 1976, the doctors told my parents, she will never walk, she will never talk, she will be a vegetable. You have a normal older daughter. You need to commit this one to an institution, put all of your focus on the older daughter, and just walk away from this one. This April 20th, I will be 43 years old. I love birthdays because with every birthday, I continue to defy all the negative messages that the doctors gave to my parents and the messages that people continue to give me that are negative. I am part of the first generation to survive to adulthood. The big obstacle to this is that adult care doctors do not have protocols in place to treat our myriad of issues. Most have never even seen a patient with spina bifida. The majority of the spina bifida population remain under the care of multiple pediatric specialists. These doctors are the only ones who have treated a large number of us. The reality is, I may never transition to adult care. Under the auspices of the Centers for Disease Control and Prevention, the National Center for Birth Defects and Developmental Disabilities, and the Spina Bifida Association had developed the National Spina Bifida Patient Registry. The registry stores data on patients from 24 spina bifida clinics in the United States. Its primary purpose is to collect information on health issues patients are experiencing, the treatments we've received, and will ultimately be studied to determine the effectiveness of the treatment. My medical information is part of the registry. My doctors at Duke University run a stellar program for treating patients with spina bifida, and I hope my medical history will help develop sound medical treatments so people with spina bifida can live longer, healthier lives. Even though I live in California, I travel to Duke University pediatric spina bifida clinic to receive care, and I am very lucky that I can afford that care. I don't live in fear of my spina bifida, but as I age, I do worry about my urologic issues. The majority of people with spina bifida are incontinent of both bowel and bladder, and I do my best to keep my bladder and kidneys healthy. I drink a lot of water, I catheterize myself on a regular basis, and I make sure to have yearly checkups with my urologist. But I have had more bladder infections than I can count, and some have sent me to the hospital. Now, the medicines I take to control my bladder spasms are no longer working, and this leaves me vulnerable to bladder infections. I have had multiple friends who have developed a bladder infection that have spread to their shunts, and they have died as a result. I've also had friends who died very quickly from kidney failure. Typical of my fellow spina bifida community members, kidney failure is my greatest fear. Like 80% of people with myelomeningocele, which is the most common and most severe type of spina bifida, I have a pump called shunt installed in my head that drains spinal fluid off of my brain. My shunt is my second heart. I cannot live without it because it drains excess fluid off my brain, which is called hydrocephalus. Hydrocephalus is incredibly dangerous. It can lead to irreparable brain damage or death if not treated. And unfortunately, there is nothing that I can do to keep my shunt functioning. If it does malfunction, I have to have brain surgery, and basically I am at its mercy. Brain surgery requires a long and very painful recovery. But I count myself very lucky that I have only had 14 shunt revisions throughout my life. I have friends younger than I who have endured 50 shunt revisions. But as a result of many shunt revisions, I have developed seizures caused by scarring on the brain. I take very powerful anti-seizure medicines to keep them under control, and I'm happy to say this medicine is working very well. I know I'm running out of time. I've read too slowly, but let me just say this. Go ahead. I know I've painted a very bleak picture. I can see it in your faces, but I love my life. I'm very proud of who I am as a woman with spina bifida. I'm very lucky to be alive and to be an American. I love living in this great nation. But the reality of the situation is that I don't ever want anyone to pity me, but I also look forward to a day when there is a cure for spina bifida. Because as much as I love my life, do I want another baby born who has 32 surgeries like I've had, or 60 surgeries like some of my friends have had? No, I don't want that. My dear friend and mentor, Tom Barag, died last November at the age of 58. I miss him more every day, but I take comfort in knowing he didn't die of a spina bifida related problem. He died from a blood clot, like so many other people who don't have spina bifida. Tom got to grow old with spina bifida. I know most adults don't consider 58 as old, but by spina bifida standards, I and Tom, we're old. My neurosurgeon jokingly tells me every time I see him, try to behave, Donna, because you are old with spina bifida. And he's right, I'm old. But I want the opportunity to grow old enough to look in the mirror and see wrinkles on my face and more gray hairs on my head than I can count. This is a dream I never allowed myself to have until I was in my 30s. I respectfully ask you to increase funding for the National Spina Bifida Patient Registry, as well as additional funding for a hydrocephalus protocol development. These funds will help those who come after me live healthier lives and help us all live long enough to see wrinkles on our faces. And I want to thank you personally for the wonderful words that you said to each and every one of us, for your commitment to our issues and your commitment to the American people and our healthcare issues. As an American and a former Hill staffer, that means so much to me. Thank you and God bless you.
Thank you. Thank you for shining a light on an area that we have not heard. I'll speak personally, that we've not heard very much about, and the work that may be being done or not being done in this area. One of the things that we are going to do with the subcommittee is to bring up the remainder of all the institutes who deal with other chronic illnesses besides cancer and besides diabetes and AIDS, etc. But to take a look across the board at what else and what are the areas in which we are, I'll say this way, falling short in terms of being able to provide dollars for research and the kinds of requests that you are making, and it is a powerful testimony. And you have no idea. Don't take the look on our faces is not one of pity, but one of inspiration. Inspiration for what you have gone through. Others would walk off the field. Adios, I'm not there, you know, but you are there. And so much of what you say here today gives us the impetus to fight on your behalf as well as for others and not see another child born or another child who may be born have the kinds of opportunities that may not be here today. So for you, thank you and God bless you. Thank you. Congresswoman Lee.
Let me first say, not only are you an eloquent spokesperson, but you're a powerful educator. And I just want to say, I associate myself with our chair's remarks, but I listened very closely to what you said. And just know, being such a powerful educator as you are, this committee has learned a lot today because of you, and will move forward in looking at what we can do to act upon your recommendations. So just thank you very much for being, and happy birthday again to you.
Isn't that just really incredible? I get chills every time I watch that recording, and we'll share it in the Facebook group or the Facebook event. So please feel free to watch it again. I think we can all learn and identify with Donna, because a big thing is that you have that same power to be an educator that Donna does. The chairman's remarks, you know, when she says literally, we don't pity you. She didn't seek sympathy. Donna wasn't seeking sympathy. Her empathy inspired them to want to take action. And you all have the exact power to do that. You really do. Whether you send a video, a letter, the big thing is you can go on your social media channels. You can send an email to your friends and families. You have no idea who needs to hear your story this week. And regardless of what you've been through or who you are, have something to say. So I encourage you all, share your stories with each other this week. Put them in the Facebook event in whatever way you want. We can give each other feedback. We can work together. Maybe yours is already perfect and ready to rock. Whatever it is, I want to hear it. And I know everybody else does too. So thank you guys so much for your time. And I really, really, really hope to see all of you in person at Teal on the Hill next year.
Thanks, Nora. So when you want to hang around, we have a few questions. And I just wanted to say too that several of us had the pleasure of sitting in the room and watching Donna give that testimony. And what many of you may not know is that over her left shoulder, or I'm sorry, her right shoulder, there were 4 seats over. Kathy Bates was testifying that same day on behalf of the Lymphedema Association. And so she was in a room with a lot of powerful people. And I will tell you that the people who were on the committee, there were a few Kleenex being pulled out with that story. That's how I knew we made the difference. And that was how we knew that we were probably going to have success last year at getting our ask, which was $8 million, which we did on the House side. The problem was the Senate. So we've concentrated this year more on the Senate because of that. But the fact of the matter is, stories do matter. They really do. And we have great stories to tell. We have stories that are full of emotion and power and the ability to overcome obstacles and people facing things they shouldn't have to, and all the challenges that you can muster. Some more so than others, but they all have that in there, and we all have to be willing to share and be vulnerable. And I think what you did was give everybody an outline of how to do that, and I really appreciate that.
I think so. So this is from Shoshana. I'm guessing this is Heidi, your mom's, but this is a great question. Last year we had a few teenagers who were on the Hill with us, and Shoshana is actually working with us right now on seeing how we can engage teens and young adults to be a stronger part of advocacy, because, you know, as they always say, children are the future. I think Will and Megan kind of touched on this earlier, and this requires a little bit more work, but I encourage you to do a little bit of research on your legislators. Even if they don't have children who might be your age, you have no idea if what other family members they might be involved in, or people in their community who they know who could be your age. They could be a teenager. If not, they might just be really passionate about something in your age group. So look at some earlier legislations, look to learn a little bit about them personally. That can always make an appeal a little bit easier. But again, I think the big thing is to just be vulnerable and emotional with what you're telling him. I do see your point that like sometimes it might make sense to be a little bit more factual, but also remember that our legislators are used to getting facts and figures all day, every day. So an emotional appeal and an emotional story is going to stick out much more to them than a factual approach, even if they're 92 years old and this is what they're used to.
Well, and keep in mind too that, you know, even though we're probably meeting with a staffer, we're not meeting with a member of Congress more than likely. And so you're not going to be meeting with somebody who's much older. You'll be meeting with somebody who might be a lot closer to your age than you realize, because Hill staffers tend to be. And, you know, the best thing, we have information to leave behind on the facts and the figures and all that. This is the time that you have to really make Spina Bifida personal to them. And you do that by sharing your story. And so, you know, and you as a 15-year-old or a 14-year-old or a 16-year-old or a future voter, they want to hear what you had to say, because you can be somebody that they might depend on in the future to get reelected. And so they're going to listen to you regardless of your age. So just keep that in mind as well too.
We will be, like has mentioned before, everyone's mentioned before, we will be sharing slides on the website later today. So if you missed a slide or you want to see like the questions or points on a slide, you can view those later. I do encourage you to look at the empowerment slide again and look at the questions that I kind of outlined. If you're having a hard time, maybe even like starting your story, kind of think about what I said earlier, which is really just why are you telling your story? And if you had one message to leave with your audience, what would it be? Sometimes it's easier to start at the end than it is to start at the beginning. So again, you'll be able to find all of those. This is a good question. Some of you are probably thinking like, how can I share my story? You know, obviously we've talked a lot about OneClick, and Nick from OneClick's about to come on and talk a little bit about the tool and how to use it. There is an option to upload a video in that OneClick tool. So if you're sending an email and you want to add an attachment, you can do that. If you would rather send it by like direct email, you can certainly do that. You would just have to get either like the staffer's name, or you can always email us and we can see if we can help you get it. But all that information's online. One thing we did learn is to make your subject line really kind of personal. They're really used to getting like standard subject lines, their inbox like by the hundreds every day. So if you put, you know, maybe something really personal to you, or where maybe your representative is from, it might stand out a little bit more and show up, and they'll actually read it. Donna's video I will put in the Facebook event, and I'm sure we can link it on our website too for those of you that don't have Facebook. Let's see, what else do we have? The Leave Behind packet is available on the website. You can absolutely reference that for your phone calls, or even if you want to reference it to put some stuff into your story. I highly recommend doing that. This is a great question. The timing of sending your story. This is true because a lot is going on with COVID right now, but actually, I recommend sending it sooner rather than later, because if we have a lot of people emailing about spina bifida in one day, that's actually a lot more impactful than 20 people emailing this week, 20 people emailing next week, and so on and so forth. The idea is to kind of mimic that we would all be in person together this week. So if you can send your story today or tomorrow, I absolutely ask that you do so. And if not, COVID has had to stop a lot of us and a lot of our normal routines. Don't let it stop our advocacy work. Let's just keep going. And I say you send it, and send it whenever you can.
So, and to go back to that too, Appropriations is still planning to move forward in its typical fashion. So now is the time. Don't wait. Even though there is a lot of emphasis on COVID-19, they're still working on an appropriations bill that will go before the House and the Senate. That work continues. We want spina bifida to be represented in it. So if we don't stand up now, we won't be. So now is the time.
Okay, maybe one more.
One.
Oh, Marquita. Yes, Marquita, you are able to do whatever you're comfortable with in terms of how you contact your members of Congress. If you want to send an email, a video, and call, you can absolutely do that. If you're a person who just wants to call, you can do that. If you just want to send a video, you can do that. The beautiful thing about advocacy is you're really allowed to be as involved in whichever way you want and to whatever degree you want. We'll never pressure you to do one over the other, or ask you to do something you're not comfortable with. The very fact that you're advocating today means a lot to us and is definitely enough for us. So we just thank you all for being here and doing that. Yeah. I think that's pretty much maybe it. Yeah.
I think that wraps it up.
Yeah, so thank you all so much. And please, again, please share your stories with us. It's a really big deal for us at the national office to know who we are, who we're representing. And as much as we try to be involved and know each of you, your stories are also a great way for us to learn more about you and how we can help you and be a better service to you and your family and everything that you have going on. And as my friend Amanda said earlier, the future, because we really are trying to make a better and brighter future. So I'd love to see them. Feel free to email me if you have any questions at all. It will be on the website. And I look forward to chatting with all of you and seeing you next year.
Thanks so much, Nora. All right. So this brings us to the one-click presentation, and I see that Nick has joined us. And so he's getting pulled up right now. So Nick, welcome to the party. We're glad you're here.
Thank you very much.
Thank you for taking time out to do this. So I'd like to introduce you to the Spina Bifida Association and some of our constituents. Unfortunately, you can't see them, but they're out there. I will be fielding questions, and so when you're finished with your presentation, then we'll do a short Q&A, and I'll read off the questions, and between the two of us, we'll try to answer them.
Perfect. Sounds good.
Right.
Yeah, so as has been referenced today throughout a few people's conversations, OneClick is the tool that the Spina Bifida Association is using to put you in contact with your legislators online. So whether that's emailing, tweeting, calling, or sending videos, we can make that very easy and straightforward for you to use. So the first thing I'm going to do here, let's see. It actually seems it's not letting me control the presentation here. I'm going to do this. All right, yes. All right, so the key features of OneClick Politics are emailing, tweeting, patch-through calling, and video. Our email tool actually has 3 methods of contact. First and foremost, we try to send an email to a legislator. Unfortunately, a lot of legislators, especially at the federal level, do not have email addresses for constituent contacts. So, if you wanted to send a direct email to them, normally they'll have a contact form online that, they prefer contacts to come in through. So first and foremost, we'll try to send an email if that exists. We'll then send your communication through a web form. If an email address does not exist, we'll send your communication through their official contact form. If that fails for any reason or doesn't exist, we'll back it up with a fax. So we have a 99.6% delivery rate. Basically, we just ensure that your contact gets to that legislator's office in any way possible. We also allow you to submit tweets to legislators. So you can fill in a tweet that will likely have some pre-filled information for you to enter, and you can tweet at your legislator. And the good part about that is that you can add some public pressure to that legislator rather than just a direct contact. Their staff that manages their Twitter account will see that, or if they personally manage it, they'll get notified, of that tweet that you sent to them. But it also then puts public pressure on them because other people know that you're contacting them. We also have the patch through calling. This allows you to very easily call your legislators. So rather than having to look up the phone numbers of all of these legislators and call them all individually, our service actually allows you to be immediately patched in to each office, all in one phone call. And I'll walk you through how that works in just a moment here. Finally, we have the video feature where you can submit videos to legislators that will be emailed to them as separate files. So here now I'm going to hop in and share my screen with you folks. Oh, sorry here, Sarah, it says I can't share my screen without while you folks are sharing yours. Alrighty, here we go. All right. So here we have the latest Teal on the Hill action that Spina Bifida has created for you folks. Here we have on the right side is the web form tool. So the first step of any of these forms is just to fill out your information. You always need to enter your name, your email address, your address, city, and zip. The address, city, and zip are used to determine who you should be contacting based on that address that you enter. So you always want to use your home address here so that you're contacting your own legislators. If it's a phone action, it'll also require your phone number so that that patch through call can work. And here they're also asking for your age. When you click next, that information is stored, and then it gives you the list of folks that you're going to be contacting here. So in this case, we're contacting all of these senators. It gives you the ability to edit the email, subject, and body that you're going to be sending here. My suggestion is always to edit the subject a bit, maybe say, from so-and-so, include your name, things like that. Just because, as Nora mentioned earlier, they get inundated with emails all the time, constantly, and to really make yours stand out, you want to differentiate it. Additionally, a lot of the larger legislative offices, especially in the Senate, have some software that easily identify form campaigns. So if you don't edit this email in any way, they're just going to really tally those up and send a form response out rather than giving each one their own individual attention there. So my suggestion is always to add a little bit of extra information, ideally, maybe some info about your story, who you are, why this is important to you. Once you've edited the email, you can connect your Twitter account here. So if you connect your Twitter, all it's going to ask you is to confirm that you will give that permission, and then you'll be able to enter your tweet. So here, Spina Bifida Association has pre-filled this information for you. You can make some edits to this, make some changes if you feel the need to. And then once you click submit, it's going to immediately send that email, and it's going to immediately send that tweet to each of your legislators individually. It seems here that I've already made a phone call, so it's not allowing me to here. But you would be able to click a start call button, at which time you would receive a phone call to that number that you entered into the form. So whether that's a mobile phone or a landline or a Google Voice number or whatever it may be, you'll receive a call at that number. When you answer, you'll hear a short greeting from Spina Bifida Association, and then you'll be immediately connected with the first office in the list. When you're speaking to that office, you can read off of this call script here. You also have this click here to expand option. So if I click here to expand, it's going to give me that full call script that I can read from here. So you're going to want to read what they provide here for you. Here we have an insert something personal. This is where you insert, an anecdote or, a short, brief piece of your story, depending on how you feel, or feel free to go into detail as well. And then once you've finished your phone calls, we're going to want to record a video. So to do that, we're just going to click the record video option. Here it's always going to show you these 4 key points here. We always recommend keeping your video 30 seconds or less, and that's just because you have a short amount of time to really be impactful with that staffer that's going to be receiving this. Most of the time it will be staff members that are going to be receiving these videos. Quite often, the legislator is not the one that's manning their inboxes from constituent mail. You always want to introduce yourself. You always want to be respectful, so try to keep away from using curse words and things like that. That will get a much less positive response than being calm and collected and respectful. We always recommend recording in a quiet location as well, so that the audio of the video comes in clearly. Here, you'll see a short blurb from Spina Bifida Association, providing you some more context and what they're asking for you on this video. I'm going to click record video. It might ask for permissions here. Here you would click record, record your 30-second video. You're able to watch that back, re-record it, all of that good stuff. And then once you've recorded a video, you'll click submit video. You have a checkbox here for approval if you want to allow Spina Bifida Association to use this video. Maybe they want to put together a, sorry about that. Maybe they want to put together a testimonials video or things like that. If you'd like to allow them to use your story, use your video, you'll want to keep this box checked. If you'd prefer that stay between you and your legislator, you're just going to want to uncheck this box and then submit your video. And then once that's submitted, all you need to do is share your video. So you can share it to Facebook, Twitter, LinkedIn, or you can share it via email and get your friends and family to take action on this campaign as well. All right, great. Actually, I'll just share my screen here again and just continue through the presentation. So a 3 key points here on being effective. So the best way to be effective with contacting your legislator is to share your story. Make it as personal as possible. Always include your own information. They're going to care a lot more about what they are hearing from you, from their their constituent, and your own personal story than they are about data that they're already receiving from lobbyists and larger organizations and things like that. It's always going to be very important to share your own personal story. Second, you always want to complete multiple points of contact. That's always my recommendation. Emailing, is good. It's not a bad thing to do, but they do receive hundreds to thousands of emails every day, and really they have a lot of staffers, staffing those inboxes and just working through those to send out responses. So they're not always the most impactful way of contacting your legislator. So you always want to follow that up with either a tweet or a video or a phone call, whatever contact makes sense for you and you feel comfortable with. For the most effective actions between these, in our experience, we have a lot of customers on a lot of issues, and what we found is that the most effective actions in creating changes, having a phone call. If you're able to call your legislator and speak to their staff members and give them your own personal story, that's going to be much more impactful than something like, you know, a tweet or an email that's, you know, just words on a screen. If they have a real human speaking to them and giving them a story, that's going to be much more effective in getting that communicated up the chain to the legislator and getting that information to them. Second would be tweets in our experience. And we believe that this is because of the sort of public pressure aspect. If they are receiving lots of tweets on their Twitter account and you know, they're being sort of called out on an issue or asked to support an issue or whatever it may be, they're going to be much more likely to put some weight behind that. Because not only will the people supporting this issue be seeing that, but also people that don't support that issue. You know, that's a really good way to get more information to people that might not be aware of spina bifida, that might not be caught up on the latest information. It's really good to always provide that option and pursue that. Third most effective we found is videos. Again, that just brings into the whole, you know, putting a face to the name, putting a real person behind that story. If they can see your face, they can hear your story with their ears. That just has a lot more emotional impact than words on the screen. And finally, emails. Though I'm saying, you know, these other actions are more effective, email is effective in its own right. It's just not quite as impactful for the people that are working with the legislator. So, you know, don't shy away from doing emails if that's what you're comfortable with. It does have an impact. So don't ever feel as if, you know, it's a waste of time. It certainly is not. But you'll be better served following up that email with those other actions. And that about covers the use of one-click politics. Does anyone have any questions for me here, or any questions on best ways to contact your legislator, any of that information?
So there was a question about if one-click is an effective platform or if we should make their own video and send via email. I will say that for us, using one-click is preferable because we can then actually keep track of how many videos, how many phone calls, how many emails were sent. If you do it on your own, it's much harder for us to know how many have been actions have been taken on our behalf at all. So I preferably would be to go through one-click, but if you're uncomfortable doing that, you are welcome to do it on your own, but you'll have to do a lot more legwork to do it on your own, to be honest. So.
It is unfortunate that at times they make it as difficult as possible to contact them. So tools like ours do help you get in contact with those legislators directly.
There is a question about do we download this or find out if there's a cost? First of all, there's no cost. SBA has made a contract with one-click, so there's no cost to participants, and you simply sign up. You create a username and password, and that's how you get in and utilize the platform. And what do you consider to be the most effective way to get in contact with our legislators? Well, I think Nick answered that question. Phone calls is the best method that we know of. And videos and tweeting, of course, also fall into there, as do emails. So, you know, the fact of the matter is, if you do all of those and really lambaste the office, then the office starts paying attention, because if you get, you know, 5, 10, 20 people all doing that, they're like, oh, something's going on. We need to pay attention to this. So being active through social media that one-click allows you to do is really important, because you know, that is something that they really pay attention to these days, is what's going on with Twitter, what's going on Facebook, and what's going on Instagram if they have an Instagram account. So I think the fact of the matter is, you know, the more you do, the better you are. And going through one-click, what we did, literally, its name is why we were so interested in it, is basically with one-click, you're able to do what you need to do. And so the fact of the matter is, it gives you all the information that you need in one place, so that you can go in and very easily to do this. So I think that answers that question. Otherwise, you have to do a whole lot of legwork to find out who your legislatures are and how to get in touch with them and all of that stuff. It's all already programmed in one click. You don't have to do that. All right, as there are no other questions, I think we will go ahead and move on. Thank you, Nick, very much for your time today. We appreciate you joining us from your home to be a part of our virtual Teal on the Hill. And hopefully tomorrow we'll have a lot of people utilizing the platform, getting our message out. So thank you very much, sir.
Thank you very much.
All right, so we are a little bit ahead of schedule, but not a whole lot. And that's fine because that means that we'll get everybody off the phone earlier than anticipated. And I think people will probably appreciate that. I'm now going to have the pleasure of turning things over to Sheila, my partner in crime, as I like to say, and she is going to walk us through what's going to happen next. So Sheila, you ready to rock and roll? There she is.
I don't see myself yet, but.
Well, I can see the top half of your face.
Oh.
There you go. Now I can see you.
Okay. Yeah, I don't know where I am, but that's okay. So what's next? It's time. Whoops, it's not advancing. Oops. Why is it not advanced? Well, it's time to advocate, which is what is next. And some of you all know me, I like to be inspired by quotes. And here's one that kind of spoke to me, that all advocacy is at its core an exercise in empathy. And that was said by Samantha Powers, who is a former U.S. ambassador to the UN. And I think that really speaks to what you heard from Nora about telling your story, and everybody has, their own unique story to tell. I don't know. Okay. Whoops, I'm going to go back. I went too far. So, you now know the advocacy priorities. Fund the National Spina Bifida program at the CDC and include the disability community in the COVID-19 relief bills. Details for all of this can be found under handouts and the Take Action tab on the website, the Teal on the Hill website. And we will have a link to the full day up on the website as soon as it's made available to us. So you do know how to tell your story now. And as you know, we talked about, that is just such a powerful part of the advocacy. Yes, it's important to ask for the funding and the COVID-19 for people with disabilities, but your story is so important. So we've provided all the tools and resources that you need. The one click or take action, as it's called. We have all the handouts you need, the advocacy priorities, and it gives you the detail on that. Information about the National Spina Bifida program, information on Spina Bifida. I mean, I know all of you know about Spina Bifida, but the person you talk to might not. And copies of today's presentations. And one other thing that's there are state fact sheets. And that's where it's included information about your particular state and Spina Bifida. And I am really excited to say that there were 43 states and the District of Columbia represented in the registration for today. So that is really awesome. And we got some people from Hawaii and Alaska. So that's the good news about it being virtual. Obviously, I know all of us would rather have in-person meetings and to be able to connect with each other in person, but we have to look for the silver lining. So, as I said, everything can be found at spinabifidassociation.org. I do want to add that we've had to readjust, just like everybody else, postponing events or going virtual. And as such, we've incurred additional expenses at a time where, excuse me, our revenue is down. You're going to receive an email following today, and it will have links to everything I've just talked about. And we are putting in an ask for your donation. No matter how small, it will really have an impact. So if you would consider making a donation so that we're able to bring you a virtual Spina Bifida Association right to your home, we would really appreciate that. And one more thank you to our sponsors, Smith & Nephew, the blue sponsor, 180 Medical, Avion, and Hollister. We really thank you for their support. There's a virtual exhibit hall where you can go and find out some more information that they've supplied us, and I think you'll find that very helpful. And like I said, I know I'm standing between you and dinner, or you and a cocktail, so, but I'm certainly happy to take any questions. I don't know if there are any.
So I think as far as tomorrow goes, Sheila, what should people expect? I mean, we've covered that a little bit, but I just want to one more time go through that because I've received several more questions throughout the day about tomorrow.
So there are kind of three things happening. If you are in one of the states and you signed up within a given amount of time, because it takes a while to get these scheduled, we have calls with senators that are on the Appropriations Committee. So you would have received an email if we were able to schedule a call like that. Those of you, again, once it's signed up within a given time period, we have sent you an individual email giving you the name of the contact in your representative's office with their phone number and their email that you can reach out to directly. And then, of course, there's one click or take action. So, and that will really help you do a lot of the same things that, you know, either being on a call or making a phone call or sending an email. You can still send an email, make a phone call, send a tweet, and a short video would be amazing. You've seen the power of some videos, and people do tend to watch videos. So those are the things we'd like you all to start doing tomorrow. I bet many of you are starting to compile your story if you haven't already. I think your voice will be powerful even if you're not able to sit across the table. With the we've had almost 350 people register for today. I know that not everybody could spend the day with us, but those of you who have registered, please reach out to your members of Congress.
So there is a question, how do we sign up for One Click or Take Action? Okay, if you go to the Spina Bifida Association homepage, you can click to Teal on the Hill. There you'll find several tabs, one of which says Take Action. And you click on that, and it first provides an overview of the issue, and then you click on it, and as Nick just demonstrated, you enter your name and your address and that kind of thing, and that pulls up your senators and your U.S. representative
so that you can reach out to those offices. If you have any questions, please email me and I will, send you a direct link or whatever I can do to help you out. Because, we want our voices to be heard.
All right, I don't see any more questions at this point in time, but I just wanted to say thank you to everyone for joining us for this experiment, as we like to call it. We would have preferred to have done this in person, obviously, as would all of you. But the fact of the matter is, given the climate we're in today, this was the safest thing for us to do. It does not mean that we will not be impactful, because I believe in this community and our ability to come together and do what we put our mind behind. We appreciate you staying tuned today. As we said, there is one question that did come in, Sheila, about the one-click presentation. Is it going to be online?
I can put it online. There were not a lot of instructions because Nick did a lot of screen shares and that sort of thing. So, I can certainly put it up, but I think you'll find if you just go to the Take Action section on Teal on the Hill, it'll step you right through what, the name, as it implies, is really one click, and I think you'll be surprised at how simple it is. I do encourage you to share a bit of your story or your story in addition to the messages that we have pre-populated for you.
We are going to be making the entire presentation available. So
that's
his
correct.
Presentation was captured there, so you should
that's
be
right.
able to see pieces of it from that, and we'll get that out as soon as we get access to it. We have to get access to it from Zoom first.
And that'll be on the main Teal on the Hill page. I've already got it set up, ready to go. So when I get that link, it'll be there.
Okay, great. And we just wanted to say thank you again for taking, there's a question, is there a word limit to the personal story in one click?
Not that I know of. I have not seen that. So if you want to email me individually, I can verify that. And my email is sroy@sbaa.org. And I would be happy to verify that.
Okay. We want to, again, thank you for taking time out of your day to join us. It's been an impactful day, and we appreciate for those of you who hung out all day and those who left and came back. And go forth, conquer tomorrow. We can do this. We can make a difference. It's up to us. And if you have any questions, please do not hesitate to reach out to us. Take care, have a great day, and stay safe. Bye.